Resolution.
House Calendar Number 73, House Resolution 413. Resolved that upon adoption of this resolution, it shall be in order to consider in the House the bill H.R. 3350 to authorize health insurance issuers to continue to offer for sale current individual health insurance coverage in satisfaction of minimum essential health insurance coverage requirement and for other purposes. All points of order against consideration of the bill are waived. The bill shall be considered as read. All points of order against provisions in the bill are waived. The previous question shall be considered as ordered on the bill and on any amendment thereto to final passage without intervening motion except one. 1 hour of debate equally divided and controlled by the chair and ranking minority member of the Committee on Energy and Commerce, and 2, 1 motion to recommit.
The gentleman from Texas is recognized for 1 hour.
Mr. Speaker, for the purposes of debate only, I yield the customary 30 minutes to the gentleman from Massachusetts, Mr. McGovern, pending which I yield myself such time as I may consume. During consideration of this resolution, all time yielded is for the purpose of debate only.
The gentleman is recognized.
Mr. Speaker, I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks.
Without objection.
Mr. Speaker, House Resolution 413 provides for consideration of H.R. 3350, the Keep Your Plan Act of 2013. The rule provides for 1 hour of debate controlled by the Committee on Energy and Commerce, equally divided between the majority and the minority. Because the bill addresses a targeted emergency situation caused by the lack of foresight in the Affordable Care Act, namely the cancellation of millions of existing health insurance plans, despite repeated promises to the contrary. Because of that, the rule makes no amendments in order. However, the minority is afforded the customary opportunity to offer 1 motion to recommit should they so choose. This is a fair rule to allow us to give some relief to Americans who actually want to keep their health insurance plan but are being told that because of the Affordable Care Act they may not. We are now 6 weeks into the disastrous launch of the President's signature health care law, and more problems are uncovered with each succeeding day. It seems that the President has quickly forgotten all of the promises made over the past 4 years to the American people about this law. In 2009, a speech before the American Medical Association, President Obama stated, "We will keep this promise to the American people. If you like your doctor, you can keep your doctor, period. If you like your health plan, you will be able to keep your health care plan, period. No one will take that away, no matter what," close quote. At the end of September, the President said, "The first thing you need to know is this. If you already have health care, you don't have to do anything," close quote. Americans from across the country, from across the ideological spectrum, agree that President Obama has broken this fundamental promise, and now his attempts to reconcile this broken promise only serve to bring further confusion and chaos. Today, H.R. 3350 offers a real solution. The bill would allow plans available on the individual market today to be offered in calendar year 2014. It would provide millions of Americans the opportunity to keep their health care plan in 2014. The bill would also ensure that Americans keeping their plans would not face a penalty under Obamacare's individual mandate. Mr. Speaker, I've heard from constituents about the problems that they have faced because of the President's law. A Texan from Flower Mound, Texas recently wrote me about how her insurance has doubled in recent years because of the Affordable Care Act. In short, she wrote me that, quote, "I missed 2009 when our family health care was affordable," close quote. Millions of Americans, just like this Texan, are losing their health care coverage. They're facing massive increases in their premiums and losing access to their care, losing access to their doctor under the Affordable Care Act. The Associated Press has reported that over 3.5 million people on the individual insurance market have had their insurance canceled. Let me restate that. The Associated Press has reported that over 3.5 million people on the individual insurance market have had their health care plans canceled. We learned just this week the number of people who successfully signed up under the President's website for the Affordable Care Act, under 27,000. 3.5 lose their insurance, 27,000 sign up. Doesn't sound like a fair trade-off. This is not the first time that the President has realized that his signature law is significantly flawed. Since the law was passed, the President has signed 7 bills into law that have repealed portions of the Affordable Care Act. Those were laws passed by the House, passed by the Senate, sent down to the White House for signature, the way it is supposed to happen in a constitutional republic. But in addition to these statutory changes that were passed by the Congress and sent down to the President for his signature, the President has taken it upon himself to issue a multitude of administrative fixes to the law. And now this same President wants to once again fix his own law? Can we really trust the administration that wrote this disastrous missive in the first place and so mishandled the implementation? Do we trust them to now fix it? Do we trust them not to change their minds in 2 or 3 weeks' time when perhaps winds are blowing from a different direction? The White House is saying that it will use its administrative authority to allow health plans that it deemed illegal to now still be able to be sold. But this bill that the House is considering today provides a fix that is both constitutional and follows the legal process. H.R. 3350 offers a legislative solution to help Americans get a lifeboat, a life raft, out from under the crushing weight of this law. The bill would grandfather in all existing health care plans, then no American would lose their coverage as a result of the Affordable Care Act. President Obama is shifting the blame. He's saying it's up to states and the state insurance commissioners to fix his problem, the massive problem that his signature law has created for millions of Americans who are losing their health insurance. His attempt at another fix is quickly coming to a halt. Just hours after the President's announcement, Washington State Insurance Commissioner announced that he will not allow insurance companies to continue offering the canceled plans. Quoting again, "We will not be allowing insurance companies to extend their policies. I believe this is in the best interest of the health insurance market in Washington," close quote. It is clear H.R. 3350 offers the only feasible lifeline to millions of Americans who are crying out for our help. They want to keep their health care plan. It's our job. It's the job of the Congress to protect the American people from the excesses of this administration, and I urge my colleagues to pass this rule so Americans will have the opportunity to keep their health care plan. Let's be very clear here. This bill today cannot fix the Affordable Care Act. What has been visited upon the American people in the Affordable Care Act will not be resolved by this action today. It is merely to stop the bleeding. It's an effort at triage, to stabilize the patient. Maybe then we can get the same patient to the operating room and actually fix the problem that bedevils it. The bill we are voting on today serves to stop that hemorrhaging, and that's hemorrhaging that is occurring as a consequence of the ill-conceived government takeover of the American healthcare industry. Any good triage doctor knows before they can fully treat or cure the patient, they have to deal with the immediate problems. In this case, they have to stop the hemorrhage of people losing their private health insurance because of the Affordable Care Act. That is what the House of Representatives will do today. That's what House Republicans will be voting in favor of. I hope that our colleagues across the aisle will see the wisdom in this and join us. I encourage everyone in this House to vote yes on the rule and yes on the underlying bill. Let's stand with millions of Americans who are visited daily by cancellation notices in their mailboxes. Despite the promises made to them, they are losing their insurance because of this disastrous law. With that, I reserve the balance of my time.
Gentleman's time is reserved. Gentleman from Massachusetts.
Mr. Speaker, I want to thank the gentleman from Texas, Mr. Burgess, for giving me the time, and I yield myself such time as I may consume.
Gentleman is recognized.
Mr. Speaker, I rise in strong opposition to this closed rule and to the underlying bill. This is effort number 46 by my count to gut the Affordable Care Act. Now, before I discuss the problems with the underlying bill, let me address, just so the record is clear, the latest example of lousy process foisted upon this House by the Republican leadership. The bill before us today would make sweeping and significant changes to the Affordable Care Act and thus to the nation's health care system. It would profoundly affect the lives of millions of Americans, upend the individual market, and add confusion and uncertainty into an already complicated situation. So, how many hearings did the Republicans hold on this bill? 0. Let me repeat that. 0. How many expert witnesses did they call? Zip. How many markups did they have in the committees of jurisdiction? Nada. Yet again, Republican promises of regular order and a thoughtful legislative process have been thrown out the window. And with all due respect to my friend from Texas, to stand here and say with a straight face that this is some kind of an emergency, we can't have any amendments made in order, we just don't have the time, defies comprehension. We have a rule that is closed that allows 1 hour of debate, not even split amongst the committees of jurisdiction. This bill, by right, is not only an Energy and Commerce bill, it's a Ways and Means bill. But the Ways and Means Committee doesn't even get any time to debate this bill. 1 hour. You mean we couldn't have 2 hours of debate and a few amendments? Or 3 hours of debate and a few more amendments? Or 5 hours of debate? Or a whole day of debate, given the fact that you didn't hold any hearings on this bill? Give me a break. This is not the way to run the House of Representatives. This is not the way you promised you would run the House of Representatives. And by contrast, on the Affordable Care Act, we had hundreds of hours of debate and markups in which Republican amendments were actually accepted. Now, you may not like the Affordable Care Act, but it went through a process. Now, this went through no process. This was just brought up to the Rules Committee, and we're told to bring it right to the floor. This is not a serious attempt to fix the Affordable Care Act. This is a political statement. And I understand the temptation behind it. Believe me, no one is more frustrated by the problems with the rollout of the Affordable Care Act than those of us who voted for it, believe in it, and want it to work. But instead of working with us to try to actually fix problems and make the law work, the Republicans have brought forth this Upton bill. Now, Mr. Speaker, let me be very clear about this bill. It is an attempt to drag us back to the bad old days of the American health care system. It would allow insurance companies to go back to offering cut-rate, shoddy policies that lack the consumer protections required by the Affordable Care Act. So, if you want to go back to a system where insurance companies could turn people away because they're sick, by all means vote for this bill. If you want to go back to a time when women were charged higher rates than men because being a female counted as a pre-existing condition, then vote for the Upton bill. If you believe that insurers should be allowed to eliminate somebody's coverage if they get sick or older or have a child or for no good reason whatsoever, then the Upton bill is for you. In short, a vote for the Upton bill is a vote in favor of everything the American people say that they hate about the health care system in this country. Yesterday, in the Rules Committee, my friend Dr. Burgess made it very clear that the Upton bill is not an attempt to fix the Affordable Care Act. They are only interested in full repeal. They are perfectly satisfied with 40 million Americans having no health insurance at all. And Speaker Boehner made a similar statement yesterday. Now, as I said, the rollout of the health care plan has not been perfect. And I know that in my own home state of Massachusetts, the rollout of our state health care law was not perfect either. But Democrats in Massachusetts did not go out of their way over and over and over and over again to sabotage it just because a Republican governor named Mitt Romney signed it into law. We worked to make it better. And by 2009, I am proud to say that my congressional district had the highest rate of insurance coverage in the entire country. That's a good thing. That's a good thing. And if my Republican friends think that we're going to go back to a system where we in Massachusetts did the right thing, but ended up paying for the uncompensated care of people in Texas or in North Carolina or Utah or anywhere else, they are wrong. At some point, we have to get serious about the goal of providing good, quality, affordable health insurance to every American. The Upton bill gets us no closer to that goal. It is yet another political waste of time. And, Mr. Speaker, let me just close by making this observation. What this debate is about, and it's turned into an ideological debate, is whether or not you believe that every single American in this country is entitled to good quality health insurance or not. My friends on the other side of the aisle obviously believe that it's okay that 40 million Americans don't have health insurance, because for the last few years they haven't offered anything other than repeal, and offering nothing as a substitute. They think it's okay to let the insurance companies decide whether you get health care or not, based on a pre-existing condition, or whether you're a female, or whether or not you're too old or too sick or whatever. I mean, they have been perfectly satisfied with the broken system that was in place. So that's the choice here. And I would urge my colleagues to understand that there's something wrong with the fact that in the greatest country in the world, and the richest country in the history of the world, that so many of our fellow citizens have no care, don't have access to health insurance. And we can fix that. And by fixing that, we not only improve the quality of life for our neighbors, our friends, our fellow citizens, but you know what? We also help control health care costs. Because one of the biggest drivers of increased health care costs is the uncompensated care pool. And so let's get serious. Let's stop this political posturing. I know you don't like the president. Boy, I mean, you have gone out of your way to say some things that are so outrageous, it's hard for me to believe that members of Congress would say such things. But get over it and do what's right for the American people. Vote no on this closed rule and vote no on the underlying bill. I reserve the balance of my time.
Gentleman's time is reserved. Gentleman from Texas.
Mr. Speaker, I'll yield myself a minute for response.
Gentleman is recognized.
First off, I do need to point out that yesterday the President of the United States thought that this situation represented an emergency that required his immediate attention, and he rushed a press conference at high noon yesterday to announce his resolution for the problem. As far as the issue of hearings, I will submit for the record a list of 8 hearings that were held in the Energy and Commerce Committee over calendar year 2013. No, I will not yield because my time is
limited. On this bill?
On the issue of grandfathering health care plans, reclaiming the time. But the most important thing I wish to point out, and for those of us who were here in 2009, we will remember, H.R. 3200 was the Democratic health care reform bill. That bill is now lost forever in the vapor, in the ether. No one knows what became of it. H.R. 3590 passed the House of Representatives July of 2009, passed as a housing bill, went over to the Senate to await further action. The further action was an amendment by Harry Reid late in December of 2009, strike all after the enacting clause and insert. All of the housing language was taken out, all of the health care language was inserted. I yield myself additional 30 seconds.
Gentleman is recognized.
As a consequence, this bill came over to the House, and we just simply had to pass it. We had to pass it before we found out what was in it. We didn't have a hearing on H.R. 3590. We didn't have a markup in any committee that I sat in 2010 on 3590. This was a bill that was visited upon the American people without the due caution and exercise of the United States House of Representatives. I yield 2 minutes to the gentleman from Minnesota, the chairman of the Education and Labor Committee, Mr. Klein.
Gentleman from Minnesota is recognized for 2 minutes.
Thank you, Mr. Speaker. I thank the gentleman for yielding time and for his incredible leadership on this issue. Dr. Burgess has been championing real solutions for over 10 years. Mr. Speaker, 140,000, that's the number of people from my home state of Minnesota who have been notified their health coverage will be canceled as a result of the President's health care law. John, a constituent from Burnsville, recently learned his own health plan is no longer available. John liked the plan he had and now has to pay 20% more to secure coverage. For many people, a cancellation notice means more than the loss of an insurance policy. It means losing access to the trusted doctors, pediatricians, nurses who care for their families. We all know how critical these relationships are, especially in difficult moments when a loved one is injured or ill. But for countless families, those relationships will soon be lost, all because Washington bureaucrats think they know best. The President promised time and again, if people liked their health care plan, they could keep it. But the American people are discovering the President failed to keep his word, leaving them with only political gimmicks and a broken website. The President may have apologized, and we appreciate that, but the country deserves a President who not only admits when he is wrong, but does what is necessary to make it right. That is why I support this legislation. The Keep Your Health Plan Act is about fairness. It's only fair to let people keep the health plan they like. No one should be forced to purchase a more expensive policy because the President says so. It's only fair to help families who are hurting across the country. The President's plan for more administrative tricks is a disservice to each and every one of our constituents. And it's only fair to hold the President accountable for the promises he makes to the American people. If the President is sincere about undoing some of the damage his law has created, if he wants to provide real solutions for those losing their coverage, and if he wants to keep his promise to our nation's families, then I urge the President to support the Keep Your Health Plan Act. And I yield back the balance of my time.
Gentleman from Massachusetts.
Yeah, Mr. Speaker, let me again remind my colleagues that not a single hearing was held on this bill. Not a single markup was held on this bill. Nothing. Nothing. And it's coming to the floor under a closed rule. That my Republican friends believe that nobody in this House, Democrats or Republicans, have any right to offer an opinion or an alternative. We're given 1 hour of debate on this, and it's not even evenly split amongst the committees of jurisdiction. One committee of jurisdiction. This is a joke. This is not what you promised. This is not the open process. This is not the transparent process on major pieces of legislation that we were promised. This is a joke. I ask unanimous consent, Mr. Speaker, to have admitted to the record a statement of administration policy that says if the President were presented with H.R. 3350, he would veto it. So this is a colossal waste of time. At this point, I'd like to yield 3 minutes to the gentlewoman from Texas, Ms. Jackson-Lee.
The lady from Texas is recognized for 3 minutes.
I thank the distinguished gentleman. Today, Mr. Speaker, I rise to save lives, to ensure that the Affordable Care Act does what it was intended to do and what it's already doing. Lifting the lifetime caps, providing preventative care, taking away the discrimination against women and others with other ethnic minorities by eliminating health disparities. This is a bill that has seen eons of hearings, not only in the underlying committee, but also in the Judiciary Committee and other committees and ad hoc hearings and briefings over and over again. I remember sitting and hearing the painful stories of families whose children had died because they could not get access to health care. But the Upton bill comes today disguised as a sheep in wolf's clothing. It discriminates against people with pre-existing conditions. It restores annual caps on the amount of care you can receive, and it forces women to pay more than men for the same coverage. This bill is not a fix. It is a dissolver of a good bill. By the way, Mr. Speaker, let me inform my colleagues that there was nothing in the Affordable Care Act that dictated to insurance companies that they had to send cancellation letters. Why don't we hold a hearing and call the CEOs of the insurance companies and ask them why they didn't send the normal letter of indicating that you have the opportunity to have a modified policy that will comply with the Affordable Care Act, that your policies are not canceled because these individuals did not pay their premium. Ask that question. I will tell you that there are health professionals and organizations that believe this particular bill will not work, and that is the American Cancer Society and American Diabetes Society. I ask unanimous consent to put this into the record.
Action.
I agree with my colleague. There should have been an open rule. And the reason that there should have been an open rule, because I had an amendment that indicated that the conditions specified in the subsection for a health insurance issuer, they must notify enrollees eligible for such continued coverage. I'm glad that the President yesterday put that language in and also said that you can opt in to your old policy. We have answered the call and concern of the American people, but we have not taken away from them the right to have consumer protections and insurance coverage that will make their lives better. I would also suggest that my amendment that indicated health insurance companies are making decisions based on their bottom line self-interest and have decided to terminate insurance plans that are not profitable in the new highly competitive marketplace for health insurance, or want to end insurance for those who are ill and thereby increase their profit margin by keeping only the healthy or marginally healthy while discarding the ill, should have been included. Because we need to speak to our friends in the insurance industry, the health insurance industry, that we're here working together, and that those letters were not necessary. Mr. Speaker, I want to save lives. I want consumer protections. I want women not to be discriminated against. And tomorrow in Houston, we're opening the doors for enrollment in a health fair that we hope thousands will come to. My friends, the Upton bill does not answer the question. Let us save lives today. And Mr. Speaker, if I might just show you...
Gentlelady's time has expired.
15 more seconds.
Yield the gentlelady an additional 30 seconds.
Gentlelady is recognized for an additional 30 seconds.
I thank the gentleman for his courtesy. This is what we lived in preceding the Affordable Care Act. 18% of the underinsured postponed getting care or treatment. Some of those people died. 15% of the uninsured had problems paying their medical bills. Hounded because they didn't have the resources. They even went bankrupt. 10% of them, of the uninsured, needed prescription drugs, but they could not afford them. 8% were hounded by collection agencies because they had to pay for their mortgage or their food. And 6% did not seek treatment at all. You know what that equals to? 100% of those individuals suffering bad health care. Let us vote down the Upton bill, vote against the underlying rule, and let's promote the Affordable Care Act, fix it like the President has done, and save lives in America. I yield
Gentleman
back.
from Texas.
Mr. Speaker, I'll yield myself 1 minute.
Gentleman is recognized.
Mr. Speaker, that evening in March of 2010, when the Senate bill was finally going to be considered by the House, there was a meeting of the Rules Committee that night. Democrats were in charge. I presented myself to that meeting with 18 amendments to Senate Bill H.R. 3590, or House Bill 3590 that had been passed by the Senate. Every one of those was summarily rejected. The problem that Democrats had that day was should we change a single word in H.R. 3590 as passed by the Senate, that the bill would have to go back to the Senate and concur with the House amendment to 3590. The majority leader in the Senate, having lost his 60th vote in a special election in Massachusetts that year, felt that he could not pass anything. He could not achieve cloture with only 59 Democrats to vote in favor of that motion for cloture. That's the reason why not one word was changed between Christmas Eve 2009 and the time this bill was actually passed. But did H.R. 3590, after it came back from the Senate, came to the Rules Committee, did it come to the House under an open rule? No, it did not. It was a closed rule. We were kept out of the process. It's hard to feel too sad for the gentleman from Massachusetts.
Gentleman's time is
Regular
expired.
order, Mr. Speaker.
I'll yield myself an additional 30 seconds.
Gentleman's recognized.
When a bill of this magnitude came with so little debate, so little input from the minority, we got a one-page bill before the House today. This was a 2,700-page bill that affected every man, woman, and child in this country, not just today, not just tomorrow, but for the next 3 decades. They'll be living under this, and it came under a closed rule. I reserve the balance of my time.
Gentleman's time is reserved. Gentleman from Massachusetts.
Mr. Speaker, what the gentleman conveniently leaves out are the hundreds of hours of hearings and markups that occurred in the committees of jurisdiction on the Affordable Care Act. The committees of jurisdiction were just cut out of this. But it's becoming a pattern in this House. This is not the only bill where the committees of jurisdiction have been cut out of the process, where members' voices have been silenced, where they're enforcing rules with an iron fist in this chamber. So this unfortunately is not unique. It's a pattern. But to suggest that we don't have the time to offer amendments is just ridiculous. We have plenty of time. We could debate this all day if we wanted to, and members could have an opportunity, both Democrats and Republicans, to amend this, given the fact that they were denied that right in the committees of jurisdiction. And, Mr. Speaker, I would like to also ask unanimous consent to enter into the record an article that appeared in the National Review Online entitled Boehner, Upton Bill, a step on the path to Obamacare repeal. Because
without objection,
what is going on here is very simple. If you believe that 40 million Americans should be without health insurance, then vote for this bill. But that's what they want to do. They want to repeal the Affordable Care Act to go back to a point where it was perfectly acceptable and okay to have 40 million Americans without health insurance. Now, many of us found that statistic unconscionable in this country, the richest country in the history of the world. And we thought it was a bad policy to allow so many uninsured Americans because that also resulted in higher health care costs. But that's what the goal here is. The goal here is to undo all the protections that allow you to keep your kids on your insurance policy until they're 26, that prohibit insurance companies from discriminating against women because they define being a female as a pre-existing condition. All these artificial rules or regulations that insurance companies threw upon people, these insurance policies that people bought thinking they had insurance only to find out when they got sick they had nothing. If you want to go back to that, then side with my Republican friends. But what we want to do here is we want to work, as we did in Massachusetts, by the way, with Governor Romney, to make this work. To make this work. And, you know, and I'll tell you, for the life of me, I don't understand why this is such a radical idea to guarantee everybody in this country good quality health insurance. With that, Mr. Speaker, I yield 3 minutes to the gentleman from New Jersey, the ranking member of the Energy and Commerce Committee, who suffered a long and arduous Rules Committee hearing last night, Mr. Pallone.
Gentleman from New Jersey is recognized for 3 minutes.
Thank you, Mr. Speaker. And I want to thank my colleague from Massachusetts not only for having to deal with the ordeal in Rules last night, but every day, but also because what he said about the lack of regular order when this Upton bill, this bill by the chairman, Mr. Upton, came to the Rules Committee. I'm a member of the Health Subcommittee, the Energy and Commerce Committee. I said in Rules last night, and I'll say again today, we have had many hearings in the Health Subcommittee. We've had hearings in the full Energy and Commerce Committee over the last 2 or 3 weeks. There was ample opportunity to have this bill proceed with regular order, with a subcommittee hearing markup, full committee hearing markup. None of that was done. This bill just comes here to the floor directly from Rules, and it is a flawed bill. I want to stress that. I really believe, Mr. Speaker, that this legislation is just another attempt by the GOP to undermine the Affordable Care Act. In fact, I'll call this the 46th attempt at repeal. My GOP colleagues have zero interest in helping people gain and keep their health insurance. They have zero interest in fixing any problems that may be occurring with the rollout of the law. They simply want to demonize the president, as you've heard over and over again, and his policies, and will go at any length to do so. And at the top of the list are their efforts to sabotage Obamacare and force its failure. Yesterday, the president took some action to help Americans who want to renew their insurance policies if their insurance companies are willing to offer that option. Ultimately, though, I believe that these people will look at the quality plans available in the new Affordable Care Act insurance marketplace and like what they see, because in most cases they will find that they're able to purchase better coverage at a lower price than their original policy, so that when they get sick or they need care, their policy will actually provide it, because most of these older policies simply do not provide adequate insurance. Now, as I said before, the Upton bill before us is not about giving people access to health care. It's about sabotaging Obamacare. One of my colleagues on the Republican side said we want to help people keep their insurance. Well, the president's initiative yesterday allows them to keep their insurance if they want to, but what the Upton bill does is allow anybody now, anybody, even if they didn't have the old insurance policy, to buy these new skeletal policies that don't provide adequate insurance. So if you take away the rhetoric of the Republicans, the Upton bill's practical effect would be to continue to allow insurers to exclude people from coverage based on pre-existing conditions, allow insurers to charge women twice as much as men for the same coverage. It would allow insurers to jack up premiums on a family if their child gets sick. It would allow insurers to set harsh annual caps on coverage. All the discriminatory practices that the ACA and Obamacare were designed to eliminate come back under the Upton bill. And this bill would not require health insurers to allow individuals to keep their current health care plans, because insurers can still do whatever they want. You can't force the insurers to offer the plans. It basically allows them to sell low-quality 2013 plans all through 2014, nothing else. Thank you, Mr. Speaker.
Gentleman from Texas.
Mr. Speaker, I recognize myself for I yield myself 3 minutes.
Gentleman is recognized.
You know, we've talked about the votes in this House to delay or modify portions of the Affordable Care Act. Indeed, the House has passed 7 of those, and they've been signed by the President. But what really gets much attention are the multiple times that the administration, the President himself, has changed parts of the Affordable Care Act. You want to talk about something that was done without any hearings. You want to talk about something that was done in a non-transparent fashion. You want to talk about something that was done without the ability to amend a debate on the floor of the House. Let's go through a few of these. Number 1 was a congressional opt-out. The administration gave members of Congress and their staffs the option of exempting themselves from the Obamacare exchanges created by the Affordable Care Act, contrary to the language of the law. Exchange enrollment. The administration extended by 6 weeks from February 14th to March 31st, 2014, the period in which people can enroll for coverage in the individual mandate, to avoid the individual mandate tax penalty. The employer delay. By an administrative action that is also contrary to statutory language in the Affordable Care Act, the reporting requirements for employers were delayed by 1 year. Self-attestation. Because of the difficulty of verifying income after employer reporting requirement was delayed, the administration decided it would allow self-attestation of income by applicants for health insurance exchanges. Small businesses on hold. The administration said that the federal exchanges for small businesses would not be ready by the 2014 statutory deadline. Instead, officials delayed until 2015 implementation of the federal shop exchanges. Closing the high-risk pools. This one was, I thought, particularly egregious. And, Mr. Speaker, I frankly do not understand why this was not covered by the nation's press. But the administration decided to halt enrollment in federal high-risk pools, blocking coverage for an estimated 40,000 new applicants, and decided, rather than using the money from a fund under Health and Human Service Secretary Sebelius's control to extend coverage for Americans with pre-existing condition, to instead use this money to pay for advertising for the Affordable Care Act. Remember, the Affordable Care Act was sold to the American people because, remember the quotes, there were 8 to 12 million people with pre-existing conditions, and yet the President's own pre-existing pool that was started in this law when it was signed in March of 2010 was closed February 1st of 2013, barely 2.5 years into its lifespan. Why have we not heard more about that? This was an administrative action to restrict people from access to the risk pools that they were told they were going to get as a consequence of the President's health care law. Many of these people probably voted for the President in November of 2012 because, after all, he was going to provide them their risk pool insurance for another year until it didn't happen. Is it any wonder why there's no faith in what the administration says it will do by administrative edict? Why there is no faith in what has come out of the White House? Why congressional action is not just constitutionally required, but it is required for the people in this country to continue to have faith in their government. I'll reserve the balance of my time.
Time is reserved. Gentleman from Massachusetts.
Mr. Speaker, the gentleman talks about faith. I think the American people have lost faith in the Republican leadership of this House. My friends are so obsessed with with this health care bill that they actually shut the government down. Ted Cruz was the Speaker of the House here for a month. I mean, they shut the government down because they do not believe that 40 million uninsured Americans ought to have health insurance. Ezra Klein, in his Washington Post piece on November 14th, writes about the Upton bill. It says it doesn't solve the cancellations problem, but it does manage to put Republicans on the side of insurers who want to continue discriminating against pre-existing conditions. I mean, that's what this is all about, giving the insurance companies more of what they want. If you want to know why, follow the money. Follow the money. It's no secret where the insurance companies' allegiances are. And quite frankly, my friends have had 3 years in control to give us their alternative. They've said no to everything. No, no, no. Try to undercut, repeal everything. And what have they offered in 3 years? What is their prescription for the uninsured in America? Take 2 tax breaks and call me in the morning. That's the best they can come up with. This is a good bill, and we need to work to implement it so we can make sure that every single American has access to good quality health insurance. With that, I yield 3 minutes to the gentlewoman from New York, Ms. Maloney.
The gentlelady from New York is recognized for 3 minutes.
I thank the gentleman for yielding and for his leadership in providing health care for over 40 million Americans that did not have it. Mr. Speaker, this is the 46th time that our Republican colleagues have tried to repeal or undermine the Affordable Care Act. I rise in opposition to this closed rule and I urge a no vote on the Upton bill. We are here today supposedly to help those people who unexpectedly had their insurance policies canceled. This is a real issue, as the President himself clearly acknowledged last night. And that is why he's taking steps to help these people in the private health care market keep their plans. However, the bill before us now not only fails to solve the problem, it makes things worse by fundamentally undermining the Affordable Care Act in a way that is calculated to doom it to eventual failure. You would be changing the rules in the middle of a game and virtually guaranteeing that premiums would eventually skyrocket for people who did the right thing, went to the exchange and got a plan. And this would price the program out of existence. And doing that would take us all back to a time when over 40 million Americans did not have access to affordable health insurance, including 2.6 million New Yorkers. We must not turn our backs on those people now. We absolutely have problems we need to fix. We have issues we need to solve. But we are on the verge of finally covering millions of Americans who lack the fundamental security of affordable health coverage for their families. We are finally close to achieving a goal for millions that has been pursued for nearly a century through Republican and Democratic administrations alike. This is a problem we must solve without turning our back on those families forced into bankruptcy simply because someone in the household got sick. This is a problem we must solve for the sake of all those women who were denied insurance or had to pay up to 40% more for insurance simply because they were women. And this is a problem we must solve for the sake of all those people with pre-existing conditions and for all those young adults who can stay on their parents' plans till they turn 27. We did not embark on this effort because we thought it would be easy. We embarked on this effort to provide health care to millions because we thought it was a moral imperative, an economic necessity, and a fundamental human right. Yes, it's hard to get it right, but ultimately this is an effort that history will judge, not by the number of computer errors, but by the number of lives saved. Mr. Speaker, I urge my colleagues to vote no on this bill and yes for health care for millions of Americans. I yield back.
Mr. Speaker, I yield myself 1 minute for the purpose of the response.
Gentleman is recognized.
Mr. Speaker, talk about changing the rules in the middle of the game. What in the world was that presidential press conference 24 hours ago all about? It was about changing the rules by executive fiat. And again, I just went through a list of many of the 27 times that the president has changed the rules in the middle of the game. What about the times the administration has been engaged in hide the ball from the American people, from the nation's governors, from the nation's insured? What about the fact that the rule for the essential health benefit was held up until 2 days after Election Day last year? And then the governors had to make a decision as to whether or not to participate in the exchanges in their states a week later. Is it any wonder they could not make a decision of that amount of import in a week's time? Sure, they were given another month's extension, but eventually 26 governors said, I can't do it based on the information provided. Another 6 governors said, okay, but the federal government is going to have to set up the exchanges. That's why you have 32 states for which the federal government is having to set up the federal fallback exchange. I'll reserve the balance of my time.
Gentleman reserves. Gentleman from Massachusetts.
Mr. Speaker, at this point, it's my privilege to yield 3 minutes to the gentleman from New Jersey, Mr. Andrews.
Gentleman from New Jersey is recognized for 3 minutes.
I ask unanimous consent to revise and extend my remarks.
Without objection, the gentleman is recognized.
Thank you, Mr. Speaker. I thank my friend for the time. In March of 2010, the President signed the Affordable Care Act. And in that law, there was a provision that said on January 1st of 2014, if insurance plans did not have important consumer protections like getting rid of lifetime policy limits and annual limits, that they couldn't be sold anymore. So for over 3.5 years, the insurance industry had noticed that the day was coming when they could not sell these plans anymore. They chose to wait until the last couple of weeks to send out notices to millions of Americans saying they couldn't renew their plans next year. This is unfair to those Americans, and it's a problem that ought to be fixed. The President has stepped forward with a plan to address this, to help those Americans. I support what he's doing. The House Democrats will have an opportunity to put on the floor some votes that will further improve that situation as this debate goes on. This problem of people having their policies canceled is unwarranted and unwelcome, and we should work together to fix it. The underlying bill here that does not fix the problem, it creates a problem. It's very important to understand what the underlying bill does. It says that insurance plans that discriminate against you because you're a woman or because you had skin cancer, or insurance plans that say that in the middle of your chemotherapy you can run out of coverage, or insurance plans that say that after you paid your premiums for months or even years, the insurance company can cancel you because you got sick. Those plans can continue to be sold to everyone. To everyone. Now, the problem that we're trying to address is people that have such plans and want to keep them be given the opportunity to keep them. That's what the President's decision does, which is why we support it. The underlying bill says that these plans can be opened up to anybody who wants to buy this. Now, that sounds kind of fair at first glance. If someone wants to buy that kind of plan, shouldn't they be able to? Well, ladies and gentlemen of the House, here's the question. If someone buys a plan that pulls the plug on their chemotherapy in the middle and they keep getting care, who pays for it? The taxpayers do, and the other premium payers do. That's who pays for it. This plan that is before the House today, this Republican bill, is a guarantee of rate shock for the American people, because here's what will happen. If anyone who wants to can buy one of these cars without an airbag or cars without seat belts, and that's what these plans are, then you will find that the new marketplaces don't have enough people in them. And when they don't have enough people in them, the rates will rise. And when the rates spike for people in the marketplaces, they will spike for people who get employer-sponsored health care. Because the possibility of competition from the marketplaces is already reducing the premium increases that employers are seeing. I would ask for another 1 minute.
I yield the gentleman an additional 1 minute.
The gentleman is recognized for an additional 1 minute.
I thank the gentleman. So the employer rates, which have risen at the slowest rates in the last 5 or 6 years, would once again be subject to the kind of spikes that happen here. Look, I think there's bipartisan agreement in this chamber this morning that if someone has gotten a cancellation notice, we want to help that person keep their plan if they choose to keep it. We agree with that. The President agrees with that. That's what he set out to do. What we do not want, and what this bill does, is to guarantee rate shock, guarantee a premium spike for Americans, whether they're in these plans that we're talking about today, whether they're in the new marketplaces, or whether they receive insurance through their employer. We need additional protections where insurance commissioners around this country can step forward and investigate arbitrary and unfair practices, where they can protect consumers. And House Democrats are going to put forward such an opportunity to vote on that at the conclusion of this debate. Let's not, in the guise of solving one problem, magnify another one. We should oppose this rule and oppose the underlying bill. I yield back.
Gentleman from Texas.
Mr. Speaker, may I inquire as to how much time remains?
Gentleman from Texas has 13 minutes remaining. The gentleman from now Colorado has 4.5 minutes remaining.
Let me yield myself 3 minutes.
Gentleman is recognized
For
for 3
purposes
minutes.
of response, the rate shock issue is one about which every member of this House should be concerned. Let me read to you from a letter that I received from a constituent who lives in the Colony, Texas, a city within my congressional district. They're complaining about the cost and the lack of transparency on the healthcare.gov website. I'm quoting here, "The prices on the Obamacare website say what we can expect based on our ages is from $372 to $600. But when I go to actually purchase, those prices automatically become $870. We don't qualify for subsidies, so that was not part of any calculation. The constituent goes on to say it's bad enough that the president has lied to us on multiple points, $2,500 a year savings, keep your plan, keep your doctor, but also the website designed to mislead us about the price as well. What is the reason that the Obamacare site and health carrier sites don't agree? I just saw a North Carolina couple on the news who had the same experience, and the insurance carrier told them that the prices on the carrier sites are correct and those prices on healthcare.gov are incorrect. You know, there is rate shock going on in the country right now. That's what part of this debate is about today. But let me just caution my colleagues on the other side of the aisle that the true rate shock experience is likely to hit in September of 2014, about 6 weeks before Election Day in November 14. What is the reason for that rate shock? Well, we all know that the healthcare.gov website was so far an abysmal failure. The administration is counting on a certain demographic to flood to that website and sign up for their wonderful new Elysian fields of Obamacare. But it's hard, so they're not going to do it. But people who are older, perhaps have multiple chronic conditions, who are actually fearful about losing their health care coverage, they're going to keep at it. Bless their hearts, they'll keep going. They'll keep coming at day and after day after day until they can finally get through and sign up for the insurance policy. Yeah, it's more expensive than I wanted, doesn't cover as much as I wanted, but by golly, I'll have something at the start of the year. The problem is the demographic that the administration counted on to sign up is not going to show up. Now, beginning about April of this next year, the insurance companies are going to begin to price risk. That's what they do. That's what they do well. So they are going to price risk, and they will post their prices somewhere along the line, July 1st to September 30th. And those prices for the renewal of health insurance are going to be staggeringly high. They'll be astonishingly high. The rate shock that is fixing to happen, you ain't seen nothing yet. It's coming in the fall, and it will be unbelievable compared to anything you've seen to date. I'll reserve the balance of my time.
Gentleman's time is reserved. Members are reminded to refrain from engaging in personalities toward the President. The restriction includes quoting from extraneous materials. Without objection, the gentleman from Colorado now controls the time and is recognized.
I thank the Speaker, and I'd like to yield 1 minute to the gentlewoman from California, the Democratic leader, Ms. Pelosi.
The gentlelady from California is recognized for 1 minute.
Thank you, Mr. Speaker. I thank the gentleman for yielding. I thank him for his leadership and that of the whole Rules Committee on having to field some really strange notions masquerading as proposals to improve the lives of the American people. And we see a lot of that these days. But this one on the floor today really takes the cake because it is essentially pull the plug on the Affordable Care Act. And while it says that they want to delay the cancellations that the insurance companies have written to policyholders, the bill does not mandate. So this is a conversation. It's not an action, but it does violence to the bill in other ways. That idea that it was helping consumers was sort of the Trojan horse whose underbelly is poisonous in terms of the health and well-being of the American people. Mr. Speaker, I rise to have come to the floor on the rule because I think it's really important for members to vote against the rule as a point of fairness. If we reject this rule and allow the Rules Committee to come back to the floor with an opportunity for there to be a Democratic alternative, that would be fair. And what we would do in the vote on the previous question, which I urge people to vote no on, would be able to vote yes or consider voting yes on a bill that does exactly what consumers need in terms of this cancellation area. First of all, it would say that there would be a real delay for 1 year for the implementation in terms of the individual policy holders. That's just this piece of the bill that is the question, individual policy. 95% of the American people, as has been said, who have policies that they like can keep them. It's this 5%, and that's a lot of people. I don't want to minimize that, but nonetheless, it's a discrete market. So let's address that discrete market, and in our previous question, we bring up a bill that addresses that discrete market, not only by enabling them to hold their policies for a year, but by requiring that the insurance companies must tell people, not that you're canceled, but these, and we want to sign you up again at a higher cost. Instead, insurance companies would be obliged to tell people what their options are. What their options are under the Affordable Care Act in terms of having no lifetime limits on their policies, no annual limits on their policies, no pre-existing condition increasing the cost of their policy, or preventing them from holding their policy should they become sick. A. B, it would also make sure that the insurance companies tell people what their options are in the exchanges, or that they may qualify for a subsidy, that they may in that marketplace. The insurance companies are competing. This is the free market, this exchange. They are competing for their policy, and therefore that has already lowered cost to consumers. So they may have a better policy with better benefits at a lower cost, and if they qualify, get a subsidy to do it. In addition to that, it's really important in every respect that in everything we do, not only just for this individual marketplace, for people to understand the benefits of the Affordable Care Act that are available to them. I mentioned no pre-existing condition, no annual limits, no lifetime limits, but also that already for the past over 1 year, young people can be on their parents'. Over 3 million people have benefited in that regard. Tens of millions of seniors have benefited from the free prevention checkup, mammograms, whatever kinds of things, prevention and wellness exams, free, no copay, no deductible. Already seniors are experiencing lowering costs for their prescription drugs because of the Affordable Care Act. Already small children cannot be discriminated against, nor their families, in seeking insurance because they have a pre-existing condition. Imagine a child born with a defect, and I think for life they have a pre-existing condition which will cost them dearly in terms of premiums if they can even get insurance, and then it would be with limits. Not so. That's all changed. That's why on this Upton bill, which, as I said, is it not only does bad things to the Affordable Care Act in terms of disrupting the risk pools, it tries to masquerade as something that does something positive, which it does not. And that is why the Upton bill is opposed by a broad coalition of groups: the American Heart Association, the American Diabetes Association, the American Cancer Society Action Network, National Partnership for Women and Families, Paralyzed Veterans of America. Anyone with a pre-existing medical, 100 million people are in families with people with pre-existing medical conditions. All of them benefit. The stories are so glorious and so beautiful about what a difference the Affordable Care Act has made to families, especially those with small children or those with pre-existing conditions, and to seniors. And again, being a woman is no longer a pre-existing medical condition. So this is politics. It's not about policy. It isn't any attempt to improve the Affordable Care Act. One way to improve it, though, is what we have in our previous question. Give the state commissioners, state insurance commissioners, the authority, all of them. Some of them have it, but ensure that all of them have the authority to investigate and act upon rate increases, as well as the nature of these letters that were sent out without the integrity that they should have had. Again, we require that they also, in these letters, that the insurance companies make sure that people know what their opportunities are. So what we are proposing today really does make a difference. In fact, we wanted to get this requirement of the insurance commissioners into the underlying bill. And then we said, okay, we'll do that as an improvement. Today is a day that we can do that by voting no on this rule and enabling us to bring a bill to the floor that would do that. With that, Mr. Speaker, I urge our colleagues to support the Affordable Care Act, support what it does for America's families, stand with those who fought for Social Security, for Medicare, affordable care for all Americans, because these are three pillars of equal weight in terms of the economic and health security of the American people. They honor the vows of our founders for life, a healthier life, liberty, the liberty to pursue your happiness so that you're not job-locked or constrained by a policy, but free to follow your passion, to be self-employed, to start a business, to change jobs, to be entrepreneurial. Life, liberty, pursuit of happiness. Vote no on the rule. With that, I yield back the balance of my time.
Gentleman from Texas.
Mr. Speaker, I'll yield myself 3 minutes.
Gentleman is recognized.
Mr. Speaker, I want to remind members of the House of Representatives about the President's press conference yesterday. I'd like to read from the transcript of his remarks. Quoting from the President yesterday, he first talked about the problems with healthcare.gov website, big problems, and maybe we can talk about those a little bit. But then he went on to say, quoting here, the other problem that has received a lot of attention concerns Americans who've received letters from their insurers that they may be losing the plans they bought in the old individual market, often because they no longer meet the law's requirements. Seems pretty straightforward to me what the President was saying yesterday. He goes on to say, further quoting, now, as I indicated earlier, I completely get how upsetting this can be for a lot of Americans, particularly after assurances that they heard from me that if they had a plan that they liked, they could keep it. And to those Americans, I hear you loud and clear. I said that I would do everything that we can to fix this problem, and today I'm offering an idea that will help do it. Already we have plans that predate the Affordable Care Act, and people can keep those plans if they haven't changed. That was already the law. That's what's called the grandfather clause that was included in the law. Today, we're going to extend that principle both to the people whose plans have changed since the law took effect and to people who bought plans since the law took effect. Ending the quotation there. You know, it's interesting. The 10th Amendment of the Constitution should actually protect the states to issue their own directives through their state insurance commissioners. They didn't need the President of the United States to do that. That is power that's been enshrined to them in the Constitution. The problem is that that power was taken away under the Affordable Care Act. Now they've attempted to bring it back, but the fact of the matter is, in many states, patients and constituents won't have that protection. But the Upton bill today will actually provide that protection. Make no mistake, the Upton bill is not a fix-it bill for the Affordable Care Act. It is a lifeline that we're extending to our constituents who have lost the coverage that they were told that they could keep. I'll reserve the balance of my time.
Gentleman's reserved his time. Gentleman from Colorado.
Yield him to the gentleman from Pennsylvania, Mr. Fattah.
Gentleman from Pennsylvania is recognized. May I inquire as to how much time the gentleman plans to yield?
It was 1 minute.
1 minute. Gentleman is recognized.
We only have a minute, 60 seconds in it. So let me be concise. On Monday, I was in San Diego with 30,000 brain researchers excited about the age of discovery and attacking diseases like Alzheimer's and bipolar and schizophrenia. On yesterday, via satellite, I spoke to a public health conference in Brussels for the European Union. Their theme was that the wealth of their member countries was the health of their populations. And then I come to the floor today where we see people who want to retreat from the ideal, which is to make sure that every single person in our country, for the first time in this nation's history, has access to affordable health care coverage. There will be no retreat. no equivocation. I know there's this desire among members on the other team always to somehow to go backwards, to some other age in our country, as if our future is in the past. Our future and the shaping impulse of our country is in the future, and it's in the health of the citizens of our country. I thank the gentleman for yielding me 60 seconds.
Gentleman's time has expired. Gentleman from Texas.
At this point, I would like to yield 5 minutes to the gentlelady from Tennessee, Vice Chair of the full committee, Marsha Blackburn.
Gentlelady from Tennessee is recognized for 5 minutes.
Thank you, Mr. Chairman. I am pleased today to stand in support of the rule that will allow us to bring the Keep Your Health Plan Act to the floor. It is important that we take this action today on H.R. 3350 because we have heard from the American people from coast to coast, that they do not want the President's health care law. They do not like the President's health care law. They feel as if, and have realized, that what is happening with this law is that, number one, it is restricting their choice and options when it comes to health insurance. And number two, the cost is skyrocketing. Now, we know that that is very important to our families who have chosen health plans that meet their needs, health savings accounts that allow them to take individual responsibility for their health care, allow them the opportunities for choosing doctors and physicians and keeping those doctors and physicians. And what the American people are telling us and our constituents are telling us is that they do indeed feel betrayed by the empty promises that the President and this administration have made. They're also quite concerned about the botched website rollout, as I said, the insurance premiums, and those cancellation notices that are hitting the mailboxes of millions of Americans. And they say, this is not what we bargained for. It's not what we were promised. It's not what we voted or spoke in favor of. And so they're asking us to take an action. And H.R. 3350 does take that action. Now, Mr. Chairman, I want to go back to 2010 when we had a conference and the President was before us, and I asked him a question about the ability to keep plans and individuals to stay insured. I spoke because of the experience we had in my state of Tennessee with the test case for Hillary Care, which was called TennCare. We saw the effects of that. We knew it was the test case for public option health care. We knew it was too expensive to afford, and overall we knew it did not work. In his response, the President mentioned a little bit about some stray cats and dogs, and that he thought they had that cleaned up. But I have to tell you, our constituents and their policies are not stray cats and dogs, and they deserve to have the opportunity to keep their health care and not to be treated in a disrespectful manner or to be discarded to the sidelines. So the President needs to realize he cannot go around waving a magic wand and fixing this by executive fiat. This is a law. We are a nation of laws, and we abide by the rule of law. Obamacare, the President's health care law, is the law of the land. In order to provide relief to the American people who have clearly spoken to say they do not want this law, it requires an action of Congress. Today's action will provide relief for some individuals, not as many as we would like, but it is one step in providing some relief. The American people have grown weary of this administration spending money that it does not have on programs the American people do not want. And the President's health care law is a great example of a program that the American people do not want. So they have come to us as the people's representative, and said and reminded us that we are a government of, by, and for the people, that should be working for the people. And as one of my constituents told me Monday, we the people are going to start being the people and holding this administration and this Congress accountable. Today is one of those steps that we are taking on behalf of our constituents and the people of this great nation. I thank the gentleman from Texas for the exceptional work that he has done in working with Chairman Upton from Michigan on bringing this to the floor, and I yield back the balance of my time.
Gentleman from Colorado.
Thank you, Mr. Speaker. I yield 1 minute to the gentleman from California, the chair of the Democratic Caucus, Mr. Becerra.
Gentleman from California is recognized for 1 minute.
I thank the gentleman for yielding. In the past month, 500,000 Americans have secured affordable health insurance. They are people that include folks in my state of California like Erin Katecki Vest, who said the old plan she had all sorts of deductibles and out-of-pocket costs. At the end of the day, what did she say after going on Covered California's marketplace exchange? She'll be saving $18,900 per year by having shopped on the exchange under the Affordable Care Act. Paulo Daoud said he passed on an employer-based insurance policy that would have cost him $504 a month. He got on Covered California's website. He picked Kaiser. He now qualifies for a plan that charges $176 a month. Alan Pasella says, my wife would not have insurance coverage at all as of January 1st. They shopped on the website. They are now saving $8,000 a year for, as he said, a very much better plan. And Andrew Stryker from Los Angeles, California, 34 years old, lives in, as I said, in my city of Los Angeles, had to wait 3 hours to enroll. $6,000 savings. Let's improve this plan. Let's not destroy it. It's time to move forward and give Americans what they need, health security. I yield back the balance of my time.
Gentleman from Texas.
Reserved time.
Gentleman reserved. Gentleman from Colorado.
Inquire if the gentleman has any remaining speakers.
Well, I'm always here, so I remain as a speaker, but it will just be me.
You're prepared to close?
Absolutely.
I yield myself the balance of my time.
Gentleman is recognized for the remaining time, which is 90 seconds.
Mr. Speaker, if we defeat the previous question, I will offer an amendment to the rule that will allow the House to vote on a substitute that allows Americans to keep their insurance if they like it. Mr. Speaker, I ask unanimous consent to insert the text of the amendment in the record along with the extraneous material immediately prior to the vote on the previous question. Mr. Speaker, there's a number of ways that we can improve upon the Affordable Care Act. One of the ones that I'd like to highlight that we could be bringing here to the floor today that the Senate already passed is comprehensive immigration reform. H.R. 15 here in the House, a bipartisan bill that I'm confident would pass if brought to the floor, would finally make a dent in the fact that there are more than 10 million people here in this country illegally, the vast majority of whom don't have any access to health care insurance. So American citizens are essentially being forced to pay for the health care costs of people who are here illegally every day until we pass comprehensive immigration reform. We're wondering why rates are going up. It's no surprise, Mr. Speaker. When somebody doesn't have insurance, their costs are shifted onto other people who do. Now, yes, there's Americans who don't have insurance, and the Affordable Care Act helps increase the access that many Americans have to insurance, but it doesn't do a thing about the fact that there's more than 10 million people here illegally in this country in violation of our laws who do not have health care insurance. If we can pass H.R. 15, Mr. Speaker, people who are here illegally will have to get insurance on their own instead of forcing Americans to pay for their insurance. I urge my colleagues to vote no on this rule, defeat the previous question, and I yield back the balance of my time.
I thank the Speaker for the recognition. I just can't help but think back to that September evening in 2009 when the President stood before a joint session of Congress after the August recess and made a statement to the nation that, he was trying to change health care, but not to worry, that no one who was in the country without the benefit of a Social Security number would be included in that cost, because many people are concerned that the cost for the Affordable Care Act, already high, would expand unreasonably if that were to change, and the President made a promise to the American people that night. Well, Mr. Speaker, we've heard a lot of stuff today. I really wish there had been that much interest in improving the Affordable Care Act before it passed the first time. We all know the reasons why those improvements were not offered and why we just simply had to have a take-it-or-leave-it proposition that was ultimately signed into law. But, Mr. Speaker, today's rule provides for the consideration of a critical bill to protect the millions of Americans who are facing the loss of health insurance that they were promised that they could keep. I certainly thank my friend from Michigan, the chairman of the Energy and Commerce Committee, Mr. Upton, for producing this thoughtful piece of legislation. At this time, I would like to yield back the balance of my time, move the previous question on the resolution, and ask for its approval by the body.
Gentleman yields back his time. All time for debate has expired. The question is on ordering the previous question on the resolution. Those in favor will say aye. Those opposed, no. Opinion of the chair, the ayes have it.
Mr.
Gentleman
Speaker,
from Colorado.
On that I request the yeas and the nays.
Yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. Sufficient number having risen, the yeas and nays are ordered. Members will record their votes by electronic device. Pursuant to Clause 9 of Rule 20, the chair will reduce to 5 minutes the minimum time for any electronic vote on the question of adoption. This is a 15-minute vote. On this vote, the yeas are 225, the nays are 193. The previous question is ordered. The question is on adoption of the resolution. Those in favor say aye. Those opposed, no. Opinion of the chair, the ayes have it. Gentleman from Florida.
Mr. Speaker, I ask for a recorded vote.
Recorded vote is requested. Those favoring a recorded vote will rise. Sufficient number having risen, a recorded vote is ordered. Members will record their votes by electronic devices as a 5-minute vote.
On this vote, the yeas are 228, the nays are 189. The resolution is adopted. Without objection, a motion to reconsider is laid on the table. House will come to order. House will come to order. For what purpose does the gentleman from Michigan seek recognition?
Mr. Speaker.
House will come to order. Gentleman from Michigan is recognized.
Mr. Speaker, pursuant to the provisions of House Resolution 413, I would call up the bill H.R. 3350 to authorize health insurance issuers to continue to offer for sale current individual health insurance coverage in satisfaction of the minimum essential health insurance coverage requirement and for other purposes, and ask for its immediate consideration. And, Mr. Speaker, the House is not in order.
The clerk will report the title of the bill.
H.R. 3350, a bill to authorize health insurance issuers to continue to offer for sale current individual health insurance coverage in satisfaction of the minimum essential health insurance coverage requirement and for other purposes.
House will come to order. Pursuant to House Resolution 413, the bill is considered read. The gentleman from Michigan, Mr. Upton, and the gentleman from California, Mr. Waxman, each will control 30 minutes. The chair now recognizes the gentleman from Michigan, Mr. Upton.
Mr. Speaker, I would ask unanimous consent that all members may have 5 legislative days to revise and extend their remarks and include extraneous material on H.R. 3350.
Without objection, gentleman will suspend. House will come to order. Members, please take your conversations off the floor.
Is that no problem?
Gentleman from Michigan is recognized.
Mr. Speaker, I would yield myself a minute and a half.
Gentleman's recognized.
Mr. Speaker, across generations, presidencies are often associated with one famous utterance: ask not what your country can do for you. The only thing we have to fear, tear down this wall. And our current president will be no different. If you like your health care plan, you can keep it, period. For the last 3 years, the president repeated this promise in selling his signature law, and he did so with the knowledge that it would not be met. Millions of Americans, including nearly 250,000 in Michigan, took the president at its word, and now, unexpectedly, are receiving cancellation notices. They are confused, worried, and upset. Today, we stand with those families with the Keep Your Health Plan Act. This bill is to help provide peace of mind to folks like the farmer in Bangor, Michigan, who just found out after purchasing his family's insurance for the last 30 years that he will be able to keep their plan no more. And the sticker shock will be unbearable as the premiums double and their deductible jumps nearly $3,000. Sadly, they're not alone. For millions of Americans, it's cancellation today, sticker shock tomorrow. For the last 6 weeks, the White House stood idly by, ignoring the pleas of millions. But as the administration's allies in Congress panicked, the White House went from attacking our thoughtful bill to making an end around Congress with a universal fix. Our straightforward one-page bill that says, if you like you...
Gentleman is correct. The House is now in order.
Our straightforward one-page bill says, if you like your current coverage, you should be able to keep it. The president should heed his own advice and work with us, the Congress, as the founders intended, not around the legislative process. Everyone today should embrace the Keep Your Health Plan Act, and our efforts to protect Americans from the damage of this law should not stop there. Let's keep the promise. I reserve the balance of my time.
The gentleman from Michigan reserves. The gentleman from California is recognized.
Mr. Speaker, I yield myself 3 minutes.
The gentleman's recognized for 3 minutes.
This bill is not a bill to let people keep their health insurance plans. The President took care of that issue yesterday. What this bill is another vote to repeal the Affordable Care Act. It would take away the core protections of that law. This bill creates an entire shadow market of substandard health care plans. It will destabilize the health insurance exchanges, raise premiums, and continue to allow insurers to discriminate on the basis of pre-existing conditions. The bill takes away the core consumer protections that are part of the law. Under the Republican bill, insurers could cherry-pick the best risks and destabilize the insurance market for everyone else. That's what we would have if they repealed the law. People would still be out of a chance to get health insurance. Now, I understand the concern of many members that individuals should be able to keep their health insurance if they like it, but there's a profound difference between providing relief for individuals whose policies have been canceled, which is what the President did yesterday, and recreating the discriminatory, inefficient insurance market that we had before health reform, which is what this bill would do. We need to have some perspective on this issue. For those currently in the individual insurance market, nearly 5 million people, they will be eligible for a tax credit worth an average of $5,000. Over 1 million more people will be eligible for Medicaid, which means additional savings. Because of better coverage that protects them from crippling medical costs, millions more will lower their out-of-pocket costs. And the 25 million Americans without insurance will finally get a good deal on quality coverage. No one can be denied coverage because of pre-existing conditions. No one can see higher rates because they get sick. No one can see their rates go up. They won't run up against annual coverage limits or realize too late that their plan didn't cover the key benefits that they need. This week, we learned that 1.5 million people have already applied for coverage, a faster sign-up rate than experienced in Massachusetts, even with all the technical problems we've had. In my state of California, nearly 400,000 people have begun applications in the first month. There will be a total of 6 months to sign up. This program is going to work. These are significant signs of progress. They show us we are on our way. Yield myself another 10 seconds.
Gentleman's recognized for an additional
15
seconds.
On our way to dramatically expanding health insurance coverage in this nation. This bill will take us backwards. I urge a no vote, and I retain the balance of my time.
The gentleman reserves the balance of his time. The gentleman from Michigan is recognized.
Mr. Speaker, I would yield 2 minutes to the gentleman from the good state of Oregon, Mr. Walden.
The gentleman from Oregon is recognized for 2 minutes.
I thank the chairman, and I thank him for bringing this bill to the floor. I rise today as the voice of at least 150,000 Oregonians who have already received their cancellation notices. They've been told the policy that they liked, that they wanted to keep, they cannot have any longer. I was out in my district for 8 straight days last week, 36 meetings, 12 counties, 2,476 miles on the road from day in the morning to late at night. And I'm going to tell you there are people like Chuck and Jan from Medford who have gone into retirement, who had health insurance, got notice that their plan has been canceled. From Mitchell to Bend, from Enterprise to Medford, all over. Not only are their plans being canceled, the replacements are coming back, folks, with deductibles that are $12,000 to $15,000 when they were paying a couple thousand. The premiums are going up, in some cases, double or more. Now, some of them may get a subsidy. A lot of them won't. And now they don't have the plan they were promised that they could keep. And another thing that's insidious that's going on below the surface, meeting after meeting, hours are being cut back, people are losing their jobs, they're getting less take-home pay because of Obamacare. This is a problem all across America. The promise that you could keep your plan was never to be kept, and they knew it, and they continued to say it, and it wasn't true. People are losing their plans, they're losing their coverage, and they're losing access to the specialists that may save their lives. That's right, they won't be able to keep their doctors. Oh, they may, but if the doctor's out of network, there's no cap on what they will pay in terms of a deductible. So financially, you take away their access to health care, the prices have gone up, the access has gone down, and oh, by the way, in many cases, they've lost their jobs or their hours have been cut back.
Gentleman's time has expired. The gentleman from California is recognized.
Mr. Speaker, I yield 2 minutes to the gentleman from New York, Mr. Rangel, who played such an important role in drafting the Affordable Care Act.
The gentleman from New York is recognized for 2 minutes.
Let me thank Mr. Waxman, Congressman Waxman, for giving me this opportunity. The majority said that presidents are remembered by certain things, and that this outstanding president will be remembered because he said if you have a plan, and he didn't say no matter how bad it is, you can keep it. I think he will be remembered historically of being the first president in the United States of America that has told people that for the first time every American will have access to affordable health care. On the other side, history's got to record them too, that they never said that they had any concern at all and never had a plan for the 30 million people that every day are waiting for this plan to go into effect, and that they would publicly acknowledge that they don't want to improve upon mistakes that may have been made, but they want to derail, to destroy, and to eliminate and to repeal universal health care for Americans. I say this, the President apologized yesterday, and I apologize to those people without insurance today for the United States Congress. If you believe that the administration has done something wrong, for God's sake, let's work together to correct it. But to just ignore the fact that 70% of Americans already have good insurance and it's going to be improved, to ignore the fact that 30 million people's lives and their legacy is in jeopardy because they can't afford to have serious illnesses, and to believe that those that belong to the 5% that really get caught in what we're supposed to be fixing today, I tell you that there's no evidence at all that the Republican Party wanted to fix anything for the uninsured of America.
Expired. The gentleman from Michigan is recognized.
Mr. Speaker, I would yield 1 minute to the gentleman from Georgia, Dr. Gingrey, a member of the Health Subcommittee.
The gentleman from Georgia is recognized for 1 minute.
Mr. Speaker, the gentleman from New York just said it. Universal health care, single-payer system, government takeover of 1/6 of our economy. That's what they wanted from the very beginning. I rise today in support of H.R. 3350, the Keep Your Health Plan Act Now. The Obama administration's health exchange enrollment announcement on Wednesday is one of the myriad reasons we must pass this bill. Frankly, these long-awaited numbers did not come as a surprise to us. A mere 100,000 registered for health care on the new marketplaces when they anticipated 500,000. According to Health and Human Services report, the number does not distinguish even between those who've actually paid a premium and those who just selected a plan by clicking a button on the website. Mr. Speaker, the number of Americans who've had their health plans canceled is in the millions, exponentially higher than those who received coverage under Obamacare. This disastrous law was destined to fail from the start. We on this side of the aisle, the Republicans, and indeed the American people, have known for 3 years that this plan is unworkable for small businesses, it's unfair for physicians and their patients, and it's unaffordable for we the taxpayer, we the people. I urge my colleagues, support H.R. 3350, and I yield back the balance of my time.
Expired. Gentleman from California is recognized.
Mr. Speaker, I yield to the top Democrat on the Health Subcommittee of Energy and Commerce, gentleman from New Jersey, Mr. Pallone. 2 minutes.
The gentleman from New Jersey is recognized for 3 minutes.
For
2 minutes.
3.
For 3 minutes. The gentleman from New Jersey is now recognized for 3 minutes.
Thank you, Mr. Speaker, and thank you, Mr. Waxman. Unfortunately, today's bill is a ruse. It claims to make things better, but all it does is to make things terribly worse. And Republicans will hide behind a soundbite and behind a nice-feeling title. But what this bill really does is to go back to the old broken health insurance system. This is just another attempt for the GOP to repeal the provisions of the Affordable Care Act. They've made it their mission to push the ACA to failure, and the only consequence of this bill is just that, seriously damaging the insurance provisions of the Affordable Care Act and the millions of Americans who are expected to benefit from the improved coverage and premium and cost-sharing subsidies available through the new health insurance marketplace. Now, the GOP claims the bill allows people to keep their health plans, but actually it allows old policies with few benefits and sometimes higher prices to be sold to new enrollees. One of the major goals of the ACA was to improve the quality of health insurance policies sold on the private market. Beginning in 2014, health insurance plans can no longer deny coverage for adults with pre-existing conditions or charge those individuals more for coverage. And there are a lot of other discriminatory practices that are eliminated by the ACA. But we need to be open to constructive changes to make this law work to the best of its ability. But that's not what the GOP is doing today. No one believes that the Republicans care about ensuring that people have health insurance. If they did, then Republicans would not, for purely political reasons, refuse to expand Medicaid with those Republican governors in the states where now 5 million hardworking Americans across 26 states will not have Medicaid expansion because of Republican politics. Mr. Speaker, yesterday the President took some action to help Americans who want to renew their old insurance policies. Ultimately, though, I hope that those Americans who want to renew those old policies will look at the quality plans available in the new Affordable Care Act insurance marketplace and like what they see, because in most cases they'll find they're able to purchase better coverage at a lower price than their original policies. So when they get sick or they need care, they'll actually have it, not with these old policies that, for the most part, are not going to provide them with good health insurance. So I urge my colleagues to oppose this bill. This is just another repeal effort on the part of the Republicans. They're not serious about trying to provide health insurance, and this will accomplish nothing for the American people. I yield back.
The gentleman yields back. The gentleman from Michigan is recognized.
Mr. Speaker, I would yield 2 minutes to the gentleman from Texas, the Chairman Emeritus of the Energy and Commerce Committee, Mr. Barton. 2 minutes. Oh, sorry. Yeah.
I don't mind letting it turn. Sorry. Okay, go right here.
The gentleman from Texas, Mr. Barton, is recognized for 2 minutes.
The surprised gentleman from Texas is recognized, and I appreciate the chairman. I ask unanimous consent to revise and extend my remarks.
Without objection.
Mr. Speaker, we're here today to begin the long process of amending, hopefully improving, and if that's not possible, at some point in time repealing the Affordable Care Act. The President, as everybody knows by now, repeatedly said that if you like your health insurance, you can keep it. Well, it has been proven that even when he said it, that was not true. And yesterday the President admitted as much when he said for the next year he would try to honor that promise, if only in the breach. The Upton bill actually correctly honors that promise the correct way by legislatively saying that insurance can continue to provide these private policies, and I would assume some employer-sponsored policies, regardless of whether they meet the new minimum standards under the Affordable Care Act. The bill does not require insurance companies to do so, but it does allow them to do so, and it is our hope as sponsors of the bill that many of those companies will do so, and it is a reasonable expectation that millions of Americans, given that choice, will actually keep the plans that they have and that they like. At some point in time, though, Mr. Speaker, This bill is not the end of the process. It is the beginning, and we need to come back and fix the rest of the law, or perhaps even change it or repeal it. I have a bill that I hope will be brought to the floor at some point in the near future that will make Obamacare voluntary. Let the American people choose what parts of the new law they like, and if they decide they don't like some parts or all of the law, they wouldn't be compelled, mandated, to continue to use some of these new policies. So, Mr. Speaker, I want to commend Chairman Upton and Subcommittee Chairman Pitts for bringing this bill so expeditiously to the floor, and I would hope that we can have a unanimous vote in support of it.
The gentleman's time has expired. The gentleman from California is recognized.
Mr. Speaker, the gentleman will not get a unanimous vote. At this time, I'd like to yield 3 minutes to the chairman of the Ways and Means Committee, Mr. Levin, to the ranking member of the Ways and Means Committee, soon to be chairman.
Gentleman from Michigan is recognized for 3 minutes.
Mr. Speaker, the Republicans are on a mission of destruction. Nothing will satisfy them except that very mission. The Upton bill is another weapon in that mission. What the Republicans fear most of all is that the health care reform will eventually work. The Upton bill is a bill to make sure that it does not work. The President has taken a step to help people keep their policies. The Upton bill opens the door to anyone at all to make sure that health care reform is not workable and that the private market cannot work. So back to the time of 50 million uninsured. So back to the time of cancellation for pre-existing conditions. So back to the time of no cap. So the alternative is bankruptcy. 8 years ago, the Medicare drug program that Republicans had passed got off to a rocky start. Did we Democrats pounce on it for political gain? No, we put the country first and helped make the program a success. The Republicans are marching in the opposite direction, the path of really destroying instead of making something work. Let's work together to make it work rather than destroying what Americans want, a healthy health program for all Americans. I yield back.
The gentleman from Michigan yields back. The gentleman from Michigan, Mr. Upton, is recognized.
Mr. Speaker, I would yield 1 minute to the Majority Leader of the House, Mr. Canner.
The gentleman from Virginia, Mr. Canner, is recognized for 1 minute.
Thank you, Mr. Speaker, and I thank the chairman, gentleman from Michigan. Mr. Speaker, I rise today in support of the Keep Your Health Plan Act. You know, many Americans today are worried. They're worried about their jobs, worried about saving for their children's college education, or worried about saving for their retirement. And now, Mr. Speaker, millions of Americans are worried about coming home, opening their mailboxes to find out that their health care coverage has been taken from them because of the President's health care law. The President repeatedly said that if you like your health care plan, you could keep it. We knew this was a promise he could not keep, and now it's a promise he has broken. As a result, millions of Americans across the country are receiving cancellation letters just like this one. Mr. Speaker, this letter was sent to me by a constituent of mine. His name is Bruno Gora. He's from Richmond, Virginia. Bruno is self-employed, and he purchases his health care plan through Anthem Blue Cross Blue Shield. A few weeks ago, he was shocked to receive this letter because this letter clearly reads, to meet the requirements of the new law, your current plan can no longer be offered. Purchasing a new plan could potentially cost Mr. Gore thousands of dollars. Why should he or anyone else be forced off their plan if they want to keep it? Working families across America were counting on this president to keep his promise. Now they're counting on us to ease some of the pain that his health care law has brought on them. Yesterday, President Obama announced that he was going to be making some unilateral changes, but the changes he proposed and the ones we are proposing in the House have some very clear differences. The President's plan restricts coverage previously available to only those who already had it, while forcing others to purchase a plan from healthcare.gov or buy more expensive coverage that may not fit their needs. The White House doesn't even know how they're going to implement the plan they announced yesterday. This proposal that we're talking about here, Chairman Upton's plan, aims to help Americans keep their health insurance and give their neighbors a chance to buy the same plans, rather than forcing them onto a faulty website to buy new coverage they may not like or cannot afford. Under this legislation, there is no confusion. The Keep Your Health Care Plan Act removes the impediment in the law that restricts insurance plans from being offered. The only way to completely stop any more cancellation letters like the one Mr. Gore received is through a full repeal of Obamacare. Today, however, we have an opportunity to stand united and pass a bipartisan measure that aims to slow the growing number of Americans harmed by this law. I would like to thank Chairman Upton for his hard work, dedication to the issue, and I urge all my colleagues in the House to support this bill. I yield back.
The gentleman from Virginia yields back. The gentleman from California is recognized.
Mr. Speaker, at this time I wish to yield 3 minutes to the Dean of the House, the Chairman Emeritus of the Energy and Commerce Committee, and the longest-standing member in support of universal health care coverage, the gentleman from Michigan, Mr. Dingell.
Speaker, I ask you to extend my remarks.
Without objection, the gentleman from Michigan, Mr. Dingell, is recognized for 3 minutes.
This time, and I express great affection and respect for my dear friend from Michigan, the gentleman, Mr. Upton, who serves the House and his constituents well. However, this is a regrettable piece of legislation. It's nothing more or less than the kind of insurance policies which are being authorized by it that were sold by snake oil salesmen around this country, which gave no relief, no help, and no benefit to the American people. The sad situation is that this not only allows some people to keep their policies, but it allows a lot of snake oil salesmen to run around the country selling bad policies which undo almost all of the protections which we have put into the Affordable Care Act. Things like protections against pre-existing conditions. The fact that a woman might be buying policies, she could be charged more under this legislation on a new policy issued by some sneaky insurance company. The harsh fact of the matter is, this is not a help to citizens. The President said yesterday he was going to take steps to correct the problems. If we really want to have this done properly, then that is the way to do it. Let us work together and have these matters corrected properly. Let us see to it that the American people get the protections that they need against abusive practices, and not that we return to them. H.R. 3350 allows new sales of bad policies which contain programs and practices barred by ACA to new and gullible purchasers, the ones that we say we seek to protect. As I observed yesterday, the insurance companies feel that this is going to cause huge confusion in the market, and they do not seek this legislation. The average citizen has been sold a bill of lading which is just plainly false. He is not going to be benefited by the H.R. 3350. He is simply going to be afforded the opportunity to buy bad policies, whereas what we want to do is to see to it that if he has his policy, he can keep it. Well, the hard fact of the matter is he can keep it, and that doesn't need the legislation before us. The legislation before us simply assures that folk can run around selling bad policies under fictional and false misrepresentations to do hurt to the American people who frankly need protection against the abuses that the Affordable Care Act would put in place. I yield back the balance of my time.
The gentleman's time's expired. The gentleman from Michigan, Mr. Upton, is recognized.
Mr. Speaker, now I would yield 1 minute to the gentleman from Louisiana, Mr. Scalise, a member of the Energy and Commerce Committee.
The gentleman from Louisiana is recognized for 1 minute.
Thank you, Mr. Speaker, for yielding, and for the gentleman from Michigan for bringing this bill, which I support. We all heard that promise. If you like what you have, you can keep it. Probably the most often repeated promise that Barack Obama made in his 5 years as president. And yet, the president's finally acknowledging that promise will not be kept to millions of Americans who are losing the good plans they like. They can't feign that they didn't know this was going to happen, by the way, Mr. Speaker, because back in 2010, the administration had a report that said over 60% of private plans would be canceled under the president's health care law. I've seen it myself in my district. I've got Chris from Covington, Aaron from Slidell, that have gotten letters saying they're going to lose the good plans that they have because of the president's health care law. And the president's answer was, oh, it was a lousy plan. Well, Mr. Speaker, it was not a lousy plan for Chris or for Aaron or for the millions of Americans that are losing their plans. They like their plan. Some Washington politician shouldn't be able to say, I don't think it's good enough, so I'm going to take it from you, even though it's right for your family. Let's put patients and doctors back in charge of these decisions. Let's empower hard-working families to be the ones in control of their health care decisions, not some Washington politician. I urge the passage of this bill, and I yield back the balance of my time.
The gentleman from Louisiana yields back. The gentleman from California is recognized.
Mr. Speaker, at this time I yield 2 minutes to the gentlelady from Illinois, Ms. Schakowsky. Mr. Speaker, my mistake. I'm yielding 3.
The gentlelady from Illinois is recognized for 3 minutes.
The number one cause of personal bankruptcies in this country is the cost of health care. Most of those people are so-called insured. These are the policies that are being offered that people find out when they get sick that they really aren't insured. And a major goal of Obamacare is to protect every consumer from the worst abuses of the private health insurance industry. And starting next year, no consumer can be denied coverage or charged more due to a pre-existing condition. This means that 129 million Americans will no longer have to live in fear that they could one day be unable to obtain affordable coverage needed to maintain their health or even to save their lives. The Upton bill would turn back the clock. The Upton bill would allow insurers to cherry pick among all health care consumers, the young, the healthy, by offering non-Obamacare compliant policies, leaving only the old and sick to purchase coverage in the marketplace. This is something they've wanted to do and have been doing for decades. This is going to drive up premiums and allow just the type of discrimination that Obamacare absolutely ends. Speaker Boehner said yesterday, we have currently the best health care delivery system in the world. Are you kidding me? With millions of people, tens of millions of people uninsured and tens of millions more with bad policies that don't cover this. So rather than taking steps to weaken Obamacare, my Republican colleagues should be taking this opportunity to build on Obamacare, as the President did, to fix it. Last week, I spoke with the director of the Illinois Department of Insurance about some of the unreasonable rate increases my constituents have faced in the past, and they're concerned about the new rates being quoted in letters they received from their insurers this fall. He told me that he doesn't have the authority he wants to protect consumers from excessive premiums. This authority includes the ability to deny or modify any unreasonable premium. And Illinois isn't alone. Today, Republicans denied us the opportunity to address this by refusing to consider legislation that would move us forward, provide rate modification authority in every state, instead choosing to move a bill that would drive up premium rates and undermine Obamacare's new benefits and protections. I want to caution people, rather than re-up with some of the policies they have, check it out. What's really covered? Is hospitalization? Is emergency room coverage? How many times can you go see your doctor? Go to the marketplace. It will be fixed. And pick a plan that is going to provide you with the real coverage, the essential benefits that you need, that are provided under Obamacare. We want to protect you from junk plans that are out there, but we want to let you re-up in plans that actually offer you the kind of coverage you want. That was essential in what the President did yesterday. I yield back.
Gentlelady's time's expired. The gentleman from Michigan is recognized.
Thank you, Mr. Speaker. At this point, I yield 2 minutes to the Republican whip. The gentleman from California, 2 minutes.
The gentleman from California is recognized for 2 minutes.
Thank you, Mr. Speaker, and I thank the chairman for his work in keeping his pledge to bring this bill to the floor. I rise today in support of H.R. 3350, the Keep Your Health Care Plan. From the start, Obamacare has been a disaster. First, the individual mandate was a bad idea before, and even more dangerous now, because it's forcing people to choose health care they do not want, cannot afford, and isn't right for themselves and their families. Second, the President's credibility continues to crumble, as independent news sources has confirmed that he intentionally broke his promise to every American about whether they can keep their insurance under this law. We will continue to see the shockwaves of Obamacare. Today, it is the fact that Americans cannot keep their coverage. Tomorrow, it'll be the staggering and unexpected cost. Next month, it'll be about losing access to their doctor, and the list continues to go. No administrative fix will undo the harm this law has caused. Republicans believe that we must try and help Americans who have been harmed by Obamacare. That is why today we'll pass a bill to allow Americans to continue to enroll in plans currently offered without facing the individual mandate penalty. What the American people and our constituents need is certainty. The only approach that begins to provide them certainty is the bill before us today. Our bill allows Americans a choice. It lets individuals keep their health care plan while giving others who currently are uninsured an escape hatch from Obamacare. Our bill will allow individuals, whether they are a mother of a sick child, a small business owner, or a young, invincible adult, to keep their current plan. The National Federation of Independent Businesses and senior groups such as 60 Plus are urging Congress to fulfill its duty and pass this bill. I urge my Democratic friends to join with us. Many of them voted for this bill. They stated they had an intent that Americans can keep their plan. Today is their opportunity to keep that pledge. I yield back.
The gentleman from California yields back. The gentleman from California, Mr. Waxman, is recognized.
Mr. Speaker, at this time I yield 2 minutes to the gentleman from the state of Washington, Dr. McDermott, who is the ranking member of the Health Subcommittee of Ways and Means.
The gentleman from Washington is recognized for 2 minutes. Without objection.
Mr. Speaker, my mother used to say patience is a virtue. I haven't seen so much panic on this floor since 9/11. Now, the fact is that a couple of members who used to be here, Jay Inslee, who's now governor of the state of Washington, Mike Kreidler, who's the insurance commissioner of the state of Washington, have already said they will not implement this because it is not good for the people of the state of Washington. They've looked at it. We have worked hard to implement the Affordable Care Act. And now we have a bill out here with no hearings whatsoever, run out here, and we're told there will be no confusion. There will be nothing but confusion. You have 50 insurance commissioners around this country who are going to be suddenly given a bill after we write some rules and regulations here that require the insurance companies to sell policies to people. I can't believe what I'm hearing. I thought the Republicans believed in the free enterprise system. This is socialism. This is government saying to insurance companies, you must sell a policy to somebody next year that you sold to them this year. When did we shift on the Republican side to the Congress telling an insurance company who they have to sell a policy to or what's in the policy? I only have 2 minutes.
Our bill does not say must sell.
The fact is that they are going to have to put the policy out there. They've been working and implementing this law for 3 years. And now, 6 weeks before it actually begins to take effect, we run in here and say, wait a minute, you got to start selling policies like the ones that you sold last year. Do you think they didn't think through what they're doing? I mean, I don't understand. The free enterprise system is lions, and they're eating antelopes. I urge you to vote no against this because you're going to create endless confusion in this country in the insurance market.
The gentleman's time's expired. The gentleman from Michigan is recognized.
Yield myself 15 seconds. The gentleman needs to read our bill. It doesn't say that the insurance companies must sell those policies. That may be in the Senate bill, the Landrieu bill. It's not in this bill. I would yield 1 minute to the Vice Chair of the Energy and Commerce Committee, Gentlelady from Tennessee, Ms. Blackburn.
Gentlelady from Tennessee is recognized for 1 minute.
Thank you, Mr. Speaker. I thank the chairman for the superb job that he has done on bringing H.R. 3350 to the floor. And I thank him for listening to millions of Americans who have been so forthright in saying, we do not want the President's health care law. It is destroying our access to the health care that we like. It is taking away our health care plans. Never has there been a federal mandate who has just swept so many people aside and said, you must buy this product. Some of you have asked why we're doing this. Let me tell you why. We're doing it for my constituents like Carolyn and Lucy and Cindy and Wilma, all small business owners, all female heads of households who have written to us and have said, we are being forced out of the plan that we like. We're being forced away from the doctor that we like. We're being forced to buy a product we do not like. I thank the gentleman. I yield back the balance of my time.
Gentlelady's time has expired. The gentleman from California is recognized.
Mr. Speaker, I yield 2 minutes to the gentlelady from California, Rosa DeLauro. From Connecticut, Rosa DeLauro. A state that also starts with a C.
The gentlelady from Connecticut is recognized for 2 minutes.
Since this Republican majority took office, we have taken vote after vote after vote intended to disrupt, delay, defund, or outright repeal the Affordable Care Act. Last month, this House majority shut down the federal government. They threatened a catastrophic debt default in order to gut this law. Now, when the Affordable Care Act is going into effect, are we supposed to believe that this Republican majority is putting forth a good faith effort to improve the bill? It doesn't wash, and it defies imagination. This bill is designed to weaken the health care law, to roll back the clock on the reforms we worked so hard to pass. It takes us back to the unacceptable state of our health care system before we passed the Affordable Care Act. Remember, the health care system was failing people. Every year, health care costs skyrocketed. Small businesses priced out of the market. Employers asking for higher contributions and copays and dropping coverage. People with pre-existing conditions were being socked or left on their own. Every year, more people had no insurance whatsoever. This bill allows insurers to continue to provide substandard health insurance plans to families, even to new customers. Americans on these plans will be denied access to preventive services with no out-of-pocket costs. It takes us back to a time when people were not guaranteed coverage for maternity, pediatric care, hospitalizations, where families faced annual caps, lifetime caps. It takes us back to a health insurance market that rejects people with pre-existing conditions. Once again, this Republican majority is trying to put insurers back in the driver's seat. Let them control the health of American families. This majority was never interested in reforming our broken health care system. They've never been interested in the Affordable Care Act, and now they are not interested as well. This is a cynical, transparently political bill. Oppose it.
Gentlelady's time's expired. The gentleman from Michigan is recognized.
Mr. Speaker, I would yield 1 minute to the chairman of the Oversight and Investigation Subcommittee on Energy and Commerce, Dr. Tim Murphy. 1 minute.
The gentleman from Pennsylvania is recognized for 1 minute.
Mr. Chairman, the majority is very concerned about health insurance plans and very concerned about those people who have lost their plans. When this bill was originally marked up a couple of years ago in the Energy and Commerce Committee, repeatedly we heard from members on the other side of the aisle saying that if people liked their plan, they could keep that indefinitely. They were grandfathered in. This needed a fix several months ago, and the President of the United States has said he wants Republicans and Democrats to work together for a solution. We're offering to work together. And yet the President has said he would veto this. But the President offered only a partial fix. It will lead to more confusion. The question is, will it lead to class action suits against insurance companies who fail to comply with the law? And many states are saying this partial fix is not sufficient. We need a legislative fix. We need a way that people can still have their option for buying their plan. And that what we have to see here is that it's a bigger problem for American families who have found that their insurance is lost and they want to be able to keep it. I yield back.
Gentleman yields back. Gentleman from California is recognized.
Mr. Speaker, may I inquire how much time is left?
Gentleman
on
from
both sides?
California has 10.5 minutes remaining. The gentleman from Michigan has 16 3/4 minutes remaining.
Mr. Speaker, at this time I yield 2 minutes to the gentleman from Maryland, Mr. Hoyer.
The gentleman from Maryland is recognized for 2 minutes.
Mr. Speaker, I rise in opposition to this bill, which will undermine the providing of health care at affordable prices for millions and millions and millions of Americans. We said to those Americans that prior to the adoption of this act, if they had a policy, they could keep it. That was accurate. Now, it didn't say that the insurance companies would have to continue to offer it, which, as I understand it, that side of the aisle wouldn't be for in any event. But the fact of the matter is that statement was correct. Now, subsequent to that, there were policies offered, and insurance companies knew, and policyholders should have known, because it was in the law, that they would be subject to minimum requirements. Why? Because as the Heritage Foundation said, when it originally came up with this idea, everybody ought to take personal responsibility. I've heard a lot of talk on your side of the aisle, Mr. Speaker, about personal responsibility. I believe in that. The Upton bill, as everybody knows, will skew the risk pool and encourage adverse selection. Anybody who knows anything about insurance knows that if you have adverse selection, the prices for those who need insurance will go up very substantially, while, yes, the prices for those who don't need insurance will go down very sharply. And very frankly, if all of us knew we would never be in an automobile accident, we wouldn't have to have automobile insurance, except, of course, the law in almost every state requires us to have it, so that others will be protected as well. Now, ladies and gentlemen, this bill is no secret. May I have 30 additional seconds?
And an additional 1 minute.
Gentleman's
I
recognized.
thank the gentleman. This bill is offered by people who, according to their own rhetoric, want to repeal the Affordable Care Act. That's a fair position. But now they are trying to do so with a Trojan horse they call the Upton bill, that in effect will fix what people are concerned about. The fact of the matter is it will not fix that problem, but what it will do is undermine the ability of millions and millions and millions of people to have health security. I would urge my colleagues to defeat this Trojan horse. I would urge my colleagues to say to the American people, look, we are prepared to work together. The President has offered a compromise which will have the effect of not opening up the policy to everybody, but to those people that had a policy. That is a reasonable step to take. That is a step that perhaps we can talk together and get accomplished. But let's reject this bill, and let's stand with the millions of people who want affordable, quality health care for themselves and their families. And, Mr. Speaker, I yield back the balance of my time that I may not have.
Michigan's recognized.
Mr. Speaker, I would yield 1 minute to the gentleman from New Jersey, a member of the Health Subcommittee on Energy and Commerce, Mr. Lance. 1 minute.
Gentleman from New Jersey is recognized for 1 minute.
Thank you, Mr. Speaker, and I rise in strong support of Chairman Upton's legislation, which will provide much-needed certainty and relief for millions of Americans, including 800,000 in New Jersey. Regarding this issue, the New York Times editorializes this morning that the President has damaged his credibility, and it is uncertain how he can earn back the public's trust. I would suggest support of this bipartisan legislation will earn back the President's trust. This matter should be addressed legislatively and permanently, and not administratively and temporarily, as the President suggested yesterday. It is time for us to work together. I strongly support Chairman Upton's legislation, and I am sure it will pass in a bipartisan fashion, and there will be bipartisan support in the other House. I yield back the balance of my time.
The gentleman from New Jersey yields back. The gentleman from Michigan is recognized.
Mr. Speaker,
California.
we reserve our time.
Gentleman from California reserves. Gentleman from Michigan is recognized.
Mr. Speaker, I would yield 2 minutes to the gentleman from Louisiana, member of the Health Subcommittee, Dr. Cassidy. 2 minutes.
The gentleman from Louisiana is recognized for 2 minutes.
Thank you, Mr. Speaker. You know, for the last 30 years, I've worked in a hospital for the uninsured, and what I've learned is that unless you trust the families, unless you give power to the patient, you truly cannot make good medical decisions. And so it comes to mind, I mean, my gosh, this is an email I got from someone who is my age, mid-50s. She says that we just got a letter from our health care provider. We had a major medical with a $10,000 deductible. We've lost that. We were told the insurance was not acceptable as written, so now our new policy has a $7,000 deductible, and it cost us $10,000 more a year. The deductible goes down by $3,000, their premium up by $10,000. This is not power to the family or to the patient. This is Washington saying, thou shalt spend thy money in the way that we direct you to spend it. Now, frankly, I don't know if we can reconstruct the private insurance market. It may have been decimated by the Affordable Care Act. The last chance probably was the Enzi resolution on the Senate side, in which it was pointed out that as many as 80% of Americans would lose their individual policy, but every Democrat voted against that Enzi resolution. But if there's a hope, it is the Keep Your Health Plan Act, which allows the policies to be resold, to occasionally be tweaked, and by the way, to be sold to others, preserving, if you will, the power of big numbers, which is key to the insurance industry. Now, the other options, the presidents, the others on the Senate side, don't allow these policies to be sold to others. And so without allowing that, of course, they are eventually going to be actuarially unsound and collapse. It is a sleight of hand which is disingenuous in terms of its intent. We must give power to the patient. We must trust families. We should pass the Keep Your Health Plan Act, allow families to make their own decisions. I yield back.
The gentleman yields back. The gentleman from California is recognized.
Mr. Speaker, I yield 2 minutes to the gentlelady from New York, Ms. Velasquez.
The gentlelady from New York is recognized for 2 minutes.
Take it back.
I thank the gentleman for yielding. Mr. Speaker, let's be clear about the bill before us today. This bill is not an attempt to help Americans keep their insurance plans. The President already announced a plan to help address that goal. Instead, this bill takes a mid-cleaver approach, allowing insurance companies to market inadequate policies to new enrollees. Remember the bad old days when pre-existing conditions were discriminated against? This bill brings back that practice. Remember, women pay more for coverage simply because of their gender? That's A-OK under this bill. Remember annual caps that let insurance companies stop paying when a consumer came down with an expensive illness? That is back too. And what about small businesses facing double-digit hikes in their premium costs? If we want to take up targeted legislation helping those whose policies are being discontinued, then let's do that. But let's call this bill what it is: a return to the days when insurance companies preyed on working families, and the 46th attempt to repeal the Affordable Care Act. I yield back.
Gentlelady yields back. The gentleman from Michigan is recognized.
Mr. Speaker, I would yield 1 minute to the gentleman from West Virginia, Mr. McKinley, a member of the Energy and Commerce Committee. 1 minute.
The gentleman from West Virginia is recognized for 1 minute.
Thank you, Mr. Chairman. I rise today to be the voice for the citizens of the 1st District of West Virginia and support House Bill 3350. Let me share just two of the messages of the thousands we've received. Linda from Philippi, West Virginia writes, I am losing my health insurance due to Obamacare. My policy has been canceled, and I'm being forced to enter the exchange. I like my current policy. Under the exchange, I will be forced to pay $200 more. I am being hurt by Obamacare. This simply isn't fair. And Sherry from Weirton, West Virginia tells us, my parents, both retired, received a letter from their insurance company letting them know their new rates starting in January. The increase is so much they can't afford it. I pray that they can continue to receive the health care that they choose so that they can continue to be healthy. They deserve better. Mr. Speaker, these are only two of the stories out of the thousands we could share. Consequently, I'm urging my colleagues to support this particular legislation. Thank you, and I yield back.
Gentleman's time's expired. The gentleman from California is recognized.
Mr. Speaker, we reserve the balance of our time.
Gentleman from California reserves. Gentleman from Michigan.
Mr. Speaker, I just might ask parliamentary inquiry. How much time is remaining on both sides?
Gentleman from California has 6 minutes. The gentleman from Michigan has 12 3/4.
Okay, Mr. Speaker, I would yield 2 minutes to the gentleman from Colorado, Mr. Gardner.
The gentleman from Colorado is recognized for 2 minutes.
I thank you, Mr. Speaker, and I thank the chairman of the committee for his work on this bill and the legislation before us. Mr. Speaker, 250,000 Coloradans have had their health care plans canceled. I joined them. Here's my letter. As one of the insurance policies I held, and one of the insurance policy holders in Colorado, I too had my insurance canceled. Part of 250,000 people who had a health care plan they were told they could keep, but they won't be able to. Noel from Eastern Colorado contacted my office to tell me that his insurance has been canceled, insurance that he liked, that he was promised by the president that he would get to keep. Mr. Speaker, Noel tells the story that he has 2 kids and a third on the way. He tells the story that his premium is going to go up by about $400 as a result of the changes under the health care bill, and that with the addition of his third child, it will go up another $300 more a month. This family doesn't make much money. For Eastern Colorado, they actually do better than others. They bring home $5,000 a month. But to see that kind of a health care cost increase when they were promised if they liked their health care bill, they could keep it, is simply wrong. We've been accused in this bill of rolling back the law. This bill does one thing. It rolls back a broken promise. It rolls back a broken promise so that we can keep our health care plans, so that the 250,000 people in Colorado can keep their health care plan. And in fact, it does go back. It goes back to a time when President Obama promised the American people that if they liked their health care plan, they could keep it, period. It goes back to a time when Kathleen Sebelius, Secretary of HHS, said, if you like your health care plan, you can keep it. It goes back to a time when the majority who passed the legislation in the House and in the Senate said, if you like your health care plan, you can keep it, period. I thank the chairman for his leadership, and I thank the Speaker. yield back my time.
Gentleman's time's expired. Gentleman from California.
Mr. Speaker, I yield 2 minutes to the gentleman from Oregon, a member of the Ways and Means Committee, Mr. Blumenauer.
The gentleman from Oregon is recognized for 2 minutes.
Thank you. I appreciate the gentleman's courtesy. The expectation that somehow the elements of the Affordable Care Act would not be implemented is just simply false. People can keep health insurance, but there are always going to be the new standards to make sure that people no longer have insurance in name only. That's what we heard about repeatedly in the efforts to try and reform the health care system, that people had great health care plans until they got sick. We have minimum standards going forward, and all plans will be required to meet those standards. That was in the law, and that is reasonable. We're in the midst of the greatest, most significant reform of health care in a generation. And it's already having significant effects. Medical inflation, medical cost inflation, is at a 40-year low over the course of the last 3 years. We have significant expansion of coverage already. Hundreds of thousands of people in lower incomes have been able to have access to health care for the first time. Small businesses that have been burdened for years by health care costs now get access to tax credits, and it gets better for them going forward. It is, I think, ironic for people to talk about somebody losing access to a doctor who's no longer in a network. That happens every year. It happened previously, it'll happen in the future, unless you're going to somehow sentence doctors to participate in plans. You can't force them. And shedding crocodile tears because there are some plans that are canceled. In this individual insurance market, routinely 40, 50, 60% every year are turned over. I sat on the floor and heard, may I have 30 additional seconds?
Yield the gentleman an additional 30 seconds.
Gentleman's recognized.
I sat on the floor and heard my colleague from Oregon, Mr. Walden, talk about a very attractive family from Southern Oregon that are somehow going to now face $12,000 deductibles. I want to do a deep dive with Greg, find out what is going on with that family. Because what we have found, people have been using Obamacare as an excuse for some things that are going to happen anyway, or people misunderstand. Let's do this together. Let's explore these areas. Let's give people information going forward. And let's make the system work better, not create a parallel system that will make it work worse.
Gentleman's time's expired. Gentleman from Michigan.
Mr. Speaker, at this point, I'd like to yield 1 minute to the gentleman from Florida, Mr. Bilirakis, member of the Health Subcommittee.
The gentleman from Florida is recognized for 1 minute.
Thank you, Mr. Speaker, and thank you, Mrs. Chairman, for sponsoring this great bill. In my state of Florida, 300,000 individuals have lost their health care plans due to Obamacare, and hardworking Americans like my constituent Mark from Pasco County are being adversely affected by this law. Mark currently has a plan that he likes, but Obamacare will take it away. His new equivalent plan on the exchange comes with a $12,000 deductible and $1,000 monthly premiums. He and his wife are about 60 years old and do not qualify for subsidies. While they are healthy. They're very healthy. They're punished, Mr. Speaker, and I don't understand. They are punished by the President's health care law. That's why I'm proud to be an original co-sponsor of Keep Your Health Plan Act, to move the barriers preventing hardworking Americans from keeping their health care plans under Obamacare. We need to pass this bill so we can give the American people the peace of mind they deserve. Thank you, Mr. Speaker, and I yield back.
Gentleman's time's expired. Gentleman from California.
Mr. Speaker, we continue to reserve
Gentleman
time.
from California reserves. Gentleman from Michigan is recognized.
Mr. Speaker, at this point, I would yield 1 minute to the gentleman from Nebraska, Mr. Terry, a member of the Energy and Commerce Committee.
Gentleman from Nebraska is recognized for 1 minute.
Mr. Speaker, this is really about trust, and people like Andrea Kodad from Omaha feels like that trust has been violated. It's been broken. She was told that she could keep her policy, but then she received her letter saying that you cannot keep your policy. Now a working mom with 2 young children, her family's premium has risen from to $770 from $450 per quarter. Her responsibility for coinsurance is now 50%, up from what it was before at 15%. Her out-of-pocket costs rose to over $2,000, and she's paying more for less now. This isn't a better policy as we have been told. It takes a big chunk of their family budget. Unfortunately, under Obamacare, she can't keep her plan. She gets more with less, and I yield back.
Gentleman yields back. The gentleman from California continues to
Mr.
reserve.
Speaker, we will continue to reserve our time.
Gentleman from Michigan is recognized.
Mr. Speaker, I'll yield 1 minute to the gentleman from Kentucky, Mr. Guthrie.
The gentleman from Kentucky is recognized for 1 minute.
Thank you, Mr. Speaker. I rise today in support of this legislation. Will allow individuals to keep their plans through 2014. Yesterday, my colleagues and I shared powerful stories of many of our constituents who have experienced cancellations and massive rate increases due to Obamacare. In addition to these individuals, I have many more stories of Kentuckians seeing their plans canceled due to Obamacare. Most recently, Sylvia Martin from Owensboro wrote to me that her coverage was canceled and she so far has been unable to get insurance. H.R. 3350 would allow insurance companies to continue offering 2013 plans, which would benefit the millions of Americans who have seen their current plans canceled. The American people were told repeatedly if they liked their plan, they could keep it. House Republicans today are trying to honor that promise. I yield back the balance of my time.
Gentleman yields back.
Mr. Speaker, we continue.
Gentleman from California reserves. Gentleman from Michigan is recognized.
Mr. Speaker, at this point, I'd like to yield 1 minute to the gentleman from Tennessee.
The gentleman from Tennessee is recognized.
Dr. Rowe, 1 minute.
Gentleman from Tennessee, Mr. Dr. Rowe, is recognized for 1 minute.
I thank the chairman. Mr. Speaker, I rise in support of the Keep Your Health Plan Act. This bill is important for many people in my district, including Joanne. Joanne lives in Limestone, Tennessee, and because her policy doesn't meet the minimum requirements set by Obamacare, she's been forced to buy a more expensive health care plan. Her premiums will rise from about $95 a month to $200 a month. Joanne thought $95 was affordable, but $200 not. Despite promises of more affordable health care, this law is making insurance unattainable for many across my home state. Blue Cross and Blue Shield of Tennessee is our state's largest insurer, and it's announced that we'll be forced to send 66,000 cancellation notices to my fellow Tennesseans because of Obamacare. A Medicaid business plan called Cover Tennessee, another 16,000 lose their care. Mr. Speaker, it's well past the time for President Obama to work with members of Congress to provide relief to the families hurting because of this law. I urge my colleagues to support the Keep Your Health Care Plan Act and yield back the balance of my time.
The gentleman yields back the balance of his time. Gentleman from California continues to reserve. Gentleman from Michigan.
May I just ask how much time each side has?
Gentleman from Michigan has 7 minutes remaining. Gentleman from California, 3.5 minutes remaining.
At this point, I'll yield 1 minute to the gentleman from North Carolina, Mr. Meadows.
The gentleman from North Carolina is recognized for 1 minute.
Thank you, Mr. Speaker. I rise today in support of H.R. 3350, the Keep Your Health Plan Act, and I'd like to thank Chairman Upton for bringing this bill forward. Despite President Obama's reassurances that if you like your health care plan, you can keep it, 3.5 million plans have already been canceled because of Obamacare. Cynthia, a constituent from Granite Falls, North Carolina, told me about her family recently. She and her husband and 3 boys have a premium that was $300, has now risen to $1,206, Mr. Speaker. Now, the rhetoric from the Democrats have said that the Republicans are only interested in pushing for a repeal of the health care law rather than fixing it. But this is just not true. So far, this Congress, Republicans have introduced 102 bills designed to fix the broken areas of Obamacare. The Democrats, by contrast, a mere 17. Republicans are bringing another fix today, Mr. Speaker, to the House floor. The Keep Your Health Care Plan allows families across the country like Cynthia's to keep their policies without penalty. I yield back.
The gentleman yields back. The gentleman from California
continue to reserve our
continues to reserve. Gentleman from Michigan.
Mr. Speaker, I'll yield 2 minutes to the gentleman from Pennsylvania, Mr. Kelly.
The gentleman from Pennsylvania is recognized for 2 minutes.
Mr. Speaker, I rise in strong support of 3350. I thank the gentleman.
This is a piece of legislation that protects the people, not a political party, not politicians, not presidents who don't keep promises. This is a letter I got from Melissa in Raleigh in Pennsylvania, Hermitage, PA. Raleigh's a college student paying for her own education. She's working part-time at minimum wage in a local grocery store, paying what she calls an affordable $70 per month for her health care coverage. Now, because of the Affordable Care Act, her hours at the store have already been cut back, and now to add insult to injury, she's been notified by the insurance provider that because of Obamacare, she will be canceled after another year, and that she's going to be forced to choose a plan that costs triple what she's paying now. Now, Raleigh's mom, Melissa, also sent a letter to our office, a letter of desperation stating that her insurance, her health insurance provider, the one she's always relied on, has now informed her that she will no longer be covered after November 25th. In her letter to our office, Melissa writes, "When my daughter or I purchase our own health care in an attempt to be self-sufficient in this country, we're penalized. We're not rewarded." Mr. President, just keep your promise. I can't believe for 3 years we've told people you can keep these policies. You don't have to worry about it, period. You like your doctor, you can keep your doctor, period. And now we find out that it was all just talk. And that's what this country's fed up with. They're tired of the talk that comes out of Washington. They want to have people start representing them. That's what we're here to do. Both sides of the aisle, ladies and gentlemen, both sides of the aisle. It's time to stop the spin. And I really feel sorry for the people that sit in the gallery here. We need to put seat belts in. This room spins so fast sometimes, it's hard for them just to walk straight when they walk out of here. But I will tell you what, our party will continue to commit ourselves to doing what's right for the American people. And with that, I yield back.
The gentleman from Pennsylvania yields back. Members are reminded to direct the remarks to the chair. The gentleman from California.
We continue to reserve our
Gentleman
time.
from Michigan.
May I, parliamentary inquiry, may I ask the gentleman from California how many speakers you have left?
We have 2 speakers left.
2 speakers? We just have 2 speakers as well, myself and Ms. Elmer. So, okay. Mr. Speaker, I'll yield 2 minutes to the gentlelady from North Carolina.
The gentlelady from North
Member
Carolina.
of the Health Subcommittee.
The gentlelady from North Carolina is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today in support of H.R. 3350 to keep your Health Care Plan Act of 2013. You know, as my colleagues across the aisle have pointed out over and over and over again, the ACA is law. But it cannot simply be undone by the White House, and it does call on us in the Congress to do so. You know, Mr. Speaker, we women in this country make 80% of the health care decisions, and women in this country have now been told by the President and our Democrat colleagues that the health care choices that they've made to cover their families are not adequate. In fact, they're being called subpar, and they're trying to intervene. They're trying to keep the women in this country from providing that good, sound health care coverage for their families. That is why we are voting on this bill today, Mr. Speaker. We're voting on it because these are good decisions that have been made by the American people. They're good decisions that have been made by the moms across this country for their families. And we need to do everything we can to protect that. So I call on my colleagues to vote yes on H.R. 3350 so that women in this country can continue to do the good job they're doing for their families and provide good health care coverage. Thank you, Mr. Speaker. I yield back.
The gentlelady yields back. The gentleman from California is recognized.
Mr. Speaker, I yield a minute to the Democratic leader, the gentlelady from California, Ms. Pelosi.
The gentlelady from California is recognized for 1 minute.
Thank you, Mr. Speaker. I thank the gentleman for yielding, and I commend him for his great leadership in helping to pass the Affordable Care Act, honoring the vows of our founders for liberty, the freedom to pursue their happinesses, life, liberty, pursuit of happiness, a healthier life, freedom to pursue that happiness. You know, it's a funny thing when people talk about Washington, D.C. and how people don't get along. Well, we disagree. We have major disagreements on policy, and one of them is whether health care is a right for all in our country or a privilege for the few. But it doesn't take away from the fact that we are people and we serve in this institution and we have some areas of agreement one day and the kaleidoscope changes the next day, to the point where people are always surprised when I say to them, I pray for the Congress every day, and on Sunday especially. I pray for our colleagues, our Republican colleagues, as well as our Democratic colleagues, as well as the President of the United States, Barack Obama or George W. Bush or whoever he may be, because the success of the President and the success of all of us is a success for the American people, if we can work together to find common ground for the public good. And when I pray for all of us, I have wishes for us. I wish that my Republican colleagues could see how successful the Affordable Care Act is in California. I wish you could hear the stories of family after family after family being liberated, freed from the constraint, being job locked because a family has a pre-existing condition, so that now they can follow their passion, not be chained by a policy, follow their passion to be self-employed, to start a business, or to change jobs. I wish you could hear all of these stories. I wish you would not close your mind to them, because this initiative has been transformative, and I would have hoped that whatever had been proposed would be to strengthen it or to improve it, and we all have the humility to know that any bill, whatever our pride of involvement in it is, can be improved. And so that is why it's particularly disappointing to come to the floor today to see a bill that says to the Affordable Care Act and all of these people with all of their stories, we are going to unravel this. We are going to unravel all of the good things, whether it's pre-existing conditions, ending that discrimination, whether it's lifetime limits, whether it's annual limits, whether it's being a woman but no longer being a pre-existing condition, whether it's for seniors or for kids 18 to 26 years old, or for little children even now before the bill is fully enacted. So I hope and I pray and I wish that our colleagues could see the evidence, and that the decisions would be evidence-based rather than politically motivated. I think it's really important what this Congress does today. Each member has to make his or her own decision. But the fact is that this body, our words weigh a ton, and our votes are even weightier than that. And I hope the message that comes out of this Congress is there's a discussion going on, but there's a values decision that has been made in favor of the American people, that if we have to thread a needle to get a result, let's do that. But let's not unravel the whole sweater, because that would not be a comfort to the American people. So let's act to strengthen, not weaken. Let's vote no on the Upton bill. Thank you. I yield back the balance of my time.
Gentlelady yields back. The gentleman from Michigan is recognized.
Mr. Speaker, we have just the close, so we'll reserve our time.
Gentleman from Michigan reserves. Gentleman from California is recognized.
Mr. Speaker, at this time I yield to the very distinguished member of the Energy and Commerce Committee, the gentleman from Pennsylvania, Mr. Doyle, the balance of our time.
The gentleman from Pennsylvania is recognized for 2.5 minutes.
Thank you, Mr. Speaker. Let's think about where America was prior to the enactment of the Affordable Care Act. 40 million of our citizens without insurance. People with pre-existing conditions either couldn't get insurance or had to pay so much they couldn't afford their insurance. Women being charged twice as much as men. People that had insurance had annual and lifetime caps. Did you ever wonder when you see families holding fundraisers to raise money for their kids' drugs so that a kid has a cancer and they're trying to raise? These were people that had insurance and come up against annual caps or lifetime caps, and the insurance company didn't pay anymore. Half the families in America filing bankruptcy. People with insurance up against caps, no more payments, families losing everything. We put an end to that with the Affordable Care Act. And how did we do that? We come up with a private system that required everybody to participate. Young and old, rich and poor, healthy and sick. Because when you put everybody in that risk pool, healthy people help us enable the insurance industry to keep rates at an affordable rate for those people who have pre-existing conditions and who have chronic diseases. That's how the system works. What my colleague Mr. Upton is proposing today unravels that system. Make no mistake about it. If we continue to allow private insurance companies to sell policies that discriminate against women, that set annual caps and lifetime caps, if we continue to allow all of those practices that every American, 80–90% of Americans said they want in their health care system, then that risk pool goes away. Then rates go sky high, and you will have raised premiums for every American in this country. Now, I would say to my colleagues, we want to fix, there are unforeseen circumstances we knew would come up in this bill. And I led the charge in my caucus. I told my caucus, if the president doesn't come up with a fix, if our leadership doesn't have an alternative solution to this, many of us would consider voting for the Upton bill, as bad as it is because it undermines the health care bill. Well, the good news is the president has responded. We will have a motion to recommit today that responds. And I want to make it clear, there's nothing in the Upton bill that mandates insurance companies to do this. This is a shall bill. In the end, just let me say, my friends, you'd have some credibility. You introduced 102 bills. You never put one of them on the floor for a vote. So don't pretend that you care about the American people's health care here. You're just trying to repeal the Affordable Care Act. Democrats are not going to let you do that.
Gentleman's time's expired. Gentleman's time's expired. Members are reminded to address their remarks to the chair and not to other members of the body. The gentleman from Michigan is recognized.
May I inquire how much time we have remaining?
The gentleman from Michigan has 2.5 minutes remaining.
I yield myself balance of time. I just say to my friend from Pennsylvania, we would have liked to have had some amendments when the Affordable Care Act passed and the rule denied us any amendments. So why are we here? Why are we here this afternoon? You know, most observers of the legislative process would say that the President's Health Care Act would never have passed back in 2010 without the assurance that the President gave, even many times this year, that you could keep your health care if you liked it. If you liked it, you didn't have to do anything, period. I don't think it would have passed in this chamber or in the Senate without that promise that the President gave. Then, millions of Americans in the last couple of months have gotten mail. And in that mail, it's the cancellation notices. And they're seeing their rates go up 200, 300, even 400%. Deductibles going up in the thousands of dollars. And people coming to us all last week when we were home for our veterans events and parades and all the things that we did, bringing those letters to us and saying, hey, what's going on? I thought I could keep this. And you know, until yesterday afternoon, when it looked like we were going to get as many as 300 votes, including perhaps Mr. Doyle's and others, when it looked like we were going to get 300 votes for a bill that we introduced only a week and a half ago, all of a sudden the President felt that he needed to act. It wasn't until this bill that he came to the mic and said, you know what? I made a mistake. I'm sorry. Maybe this thing will fix it. But until then, he was going to sit on his hands and just watch us. Watch millions of Americans literally watch their health care, watch maybe their economic lives just go over the cliff. He was prepared to do that until we showed that we had some bipartisan zip around here to try and, in fact, enforce, make whole his promise that he has said over and over and over again. That's what this bill does. Read it. It's not too long, a couple sentences long. I commend our leadership for bringing this bill to the floor as fast as they can. Man, 5 or 6 legislative days from when it was introduced, that's pretty good. But more importantly, it got a wake-up call to someone down the street on Pennsylvania Avenue saying, hey, something's wrong. Let's restore what we might have said. I yield back my time and urge my colleagues to vote yes on the bill.
The gentleman yields back the balance of his time. All time for debate has expired. Pursuant to House Resolution 413, the previous question is ordered on the bill. The question is on engrossment and third reading of the bill. Those in favor say aye. Those opposed, no. The ayes have it. Third reading.
A bill to authorize health insurance insurers to continue to offer for sale current individual health insurance coverage in satisfaction of the minimum essential health insurance coverage requirement and for other purposes.
Speaker.
The gentleman from Michigan. For what purpose does the gentleman from New Jersey seek recognition?
Mr. Speaker, I have a motion to recommit at the desk.
Is the gentleman opposed to the bill?
I am opposed to the bill.
The gentleman qualifies. The clerk will report the motion. The clerk will suspend. For what purpose does the gentleman from Michigan rise?
Now I reserve a point of order. Now I reserve a point of order.
Point of order from the gentleman from Michigan has been reserved. The clerk will continue.
Mr. Andrews of New Jersey moves to recommit the bill, H.R. 3350, to the Committee on Energy and Commerce with instructions to report the same back to the House forthwith with the following amendment. Strike all after the enacted clause and insert the following. Section 1, short title. This act may be cited as the Consumer Health Plan Protection Act of 2013.
Dispense with a reading.
Is there objection?
We would like to hear it.
There is objection. The clerk will continue.
Section 2, maintaining existing coverage. A, in general, notwithstanding any provision of the Patient Protection and Affordable Care Act, including any amendment made by such act or by the Health Care and Education Reconciliation Act of 2010, in the case of health insurance coverage offered by a health insurance issuer in the individual market that is in effect for an individual as of October 1st, 2013, the issuer may continue such coverage for such individual for a planned year beginning in 2014 in such market outside of an exchange established under Section 1311 or 1321 of such Act, 42 U.S.C. 18031, 18041. B. Treatment is grandfathered health plan in satisfaction of minimum essential coverage. Health insurance coverage described in subsection A shall be treated as a grandfathered health plan for purposes of the amendment made by Section 1501B of the Patient Protection and Affordable Care Act. C. Notice.
Mr. Speaker, we urge that we dispense with the reading of the bill.
Is there objection?
Or of the motion recommit.
There is no objection. The clerk will suspend. Gentleman from New Jersey is recognized for 5 minutes in support of this motion. Without objection.
Thank you. Mr. Speaker, my colleagues, we've listened to the many stories told by people this morning with great empathy about people who got a cancellation notice and want to keep the policy that they have. The issue before the House is whether we want to solve the problem or create another problem. That's the issue. If we want to work together, as we should, to solve the problem of Americans receiving cancellation notices and not being able to keep policies that they have, it requires us to do three things. First, we have to legally authorize insurance companies to offer these policies on into the future. The Democratic plan, which I have proposed, does that. And frankly, so does Mr. Upton's bill. The second thing that we have to do, though, is make sure that the insurance companies offer the plans for sale. It really does you no good at all if you have the right to buy a plan that the insurance company refuses to sell. Mr. Upton's bill is mute on that point. It might be called the insurance company's Bill of Rights, because they have the right to do or not do anything they choose. But the people that we all say that we want to protect really have no rights at all. This is an important distinguishing point in the plan that I'm offering now, and I urge everyone to support. We have drawn from language offered by my friend from Illinois, Ms. Schakowsky, which requires state insurance commissioners around this country to be vigilant protectors of consumers rather than corporate apologists for insurance companies. Our plan says that if someone's cancellation was arbitrary and thoughtless and unfair, the insurance commissioner must act and protect the people that we heard read in those letters today. Our plan says that if rate increases are discriminatory, if you got a rate increase because you're a woman who was pregnant, or you got a rate increase because you had skin cancer, or breast cancer, or diabetes, that the insurance company, the insurance commissioner rather, must act and protect the consumer against that indignity. It does you no good that this bill is called the Keep Your Insurance If You Want To bill. It should be called the Keep Your Insurance If You Want To and the insurance company allows you to bill. We are correcting that wrong and remedying that wrong with our plan. And thirdly, it doesn't do any good to give people the chance to renew their plans if that renewal results in a huge premium increase for everyone else in the country. That is what the underlying bill does. The underlying bill says that these plans, which I would really equate to selling an automobile with no airbags and no seatbelts. Now, our plan says, look, if you want to keep driving a car with no airbags and no seatbelts, you can keep driving. But people can't sell a car with no airbags and no seatbelts to a new consumer, which is what the underlying bill permits. Now, when that happens, here's what's going to happen. People in the new state marketplaces are going to see a huge increase in their premiums. People who get covered at work are going to see a huge increase in their premiums. It's going to spill over to Medigap policies for seniors and people on Medicare. The bill really should be called the Guaranteed Premium Increase Act of 2013, because that's what it is. Our bill corrects that by saying, let's help the people we say we want to try to help. People who like their plan and want to keep it, not everyone that the insurance company could dupe or lure into buying a car with no airbag and no seatbelts. And finally, working together means not forgetting about some other people who write letters we haven't heard much about today. The family Mr. Doyle talked about, whose daughter has cancer, who has an insurance policy, but has to have a beef and beer or a golf tournament to raise money to pay their bills. I want to help that person and not repeal the Affordable Care Act. How about the woman who had breast cancer 10 years ago and can now be told, we're sorry, you can't buy an insurance policy, or you got to pay more if you do. I want to help her by banning discrimination based on pre-existing conditions. If we really want to work together, let's adopt this plan. Let's really help the people we're saying are trying to help, and not the insurance industry of the United States of America.
Gentleman's time's expired. For what purpose does the gentleman from Michigan seek recognition?
Mr. Speaker, I must regret that I do insist on the point of order. In my opinion, the pending amendment violates Clause 7 of Rule 16 of the Rules of the House, which requires that an amendment be germane to the matter it is amending. It is not germane to the bill because Section 3 imposes a mandate on state insurance commissioners, and Section 4 amends the Public Health Service Act, which is in fact beyond the scope of the base text.
Does anyone else wish to speak to the point of order?
I do, Mr. Speaker. I'd like to hear on the point of order.
To speak to the point of order.
Mr. Speaker, my understanding is my friend, the chairman's objection is based on the principle of germaneness. The underlying bill, by its very title, purports to protect Americans who have received a cancellation notice for a policy that they want to keep. Now, there's a disagreement here over how to protect those Americans. The underlying bill does not have requirements that state insurance commissioners act to protect those individuals. Our plan does. Our plan does. Now, this is a disagreement over the means to protect American consumers. The underlying bill says we'll trust the insurance industry. Our bill says no, we'll enforce the insurance laws. I would respectfully submit this does not rise to a difference in germaneness. This is a difference of opinion. The bill on the floor purports to protect the Americans that I talked about. We think it doesn't. Our plan does protect those Americans in a different way. The underlying subject matter of this bill is how do you protect Americans who wish to keep the insurance plan that they have. We believe we have a more effective way of doing that. The majority disagrees. The House deserves a vote on that. No technicality, no procedural nicety should deny us the chance to take a vote on whose plan is right. We should proceed with this vote.
Does anyone else wish to speak to the point of order? Seeing none, the chair is prepared to rule. The gentleman from Michigan makes a point of order that the instructions proposed in the motion to recommit offered by the gentleman from New Jersey are not germane. Clause 7 of Rule 16, the germaneness rule, provides that no proposition on a subject different from that under consideration shall be admitted under color of amendment. The bill permits health insurance issuers that offer health insurance coverage in the individual market on January 1, 2013 to continue to make such coverage available for sale during 2014. The amendment proposed in the motion to recommit in pertinent part requires state insurance commissioners to examine notices of health insurance cancellations or conversions. It also addresses the regulation of health insurance rates. Specifically, the amendment delineates what would constitute inadequate notice of cancellation or conversions of health insurance coverage and directs state insurance commissioners to investigate such cases of inadequate notice. Additionally, it permits the Secretary of Health and Human Services or the relevant state insurance regulator to take corrective actions if health insurance rates are determined to be excessive, unjustified, or unfairly discriminatory. Such corrective action may include the assessment of civil monetary penalties. The bill does not address any of those subject matters. Instead, it is confined to the subject matter of extending into 2014 the authority to offer health insurance coverage that was for sale on the individual market in 2013. The chair therefore finds that the amendment proposed in the motion to recommit goes beyond the subject matter of the underlying bill. It is therefore not germane. The point of order is sustained. The gentleman from New Jersey.
I respectfully appeal the ruling of the chair.
The question is, shall the decision of the chair stand as the judgment of the House? For what purpose the gentleman from Michigan
Speaker, I
asks?
would move to table the appeal of the ruling of the chair.
The question's on the motion to table. Those in favor shall say aye. Those opposed shall say no. In the opinion of the chair, the ayes have it.
Speaker, on that I demand the yeas and nays.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, the yeas and nays are orders. Members record their votes by electronic device. Pursuant to Clause 9 of Rule 20, this 15-minute vote on the motion to table will be followed by a 5-minute vote on passage of the bill if arising without further proceedings in recommittal. This is a 15-minute vote. The nays are 186.
Mr. Young of Alaska. Mr. Young of Alaska votes aye. Ms. Wilson of Florida. Ms. Wilson of Florida votes aye. Mr. Huizenga. Mr. Huizenga of Michigan votes aye. Mr. Holding. Mr. Holding voted aye. Mr. Brady of Texas. Mr. Brady of Texas voted aye. Mrs. Caroline Maloney of New York. Mrs. Caroline Maloney of New York votes no. Mr. Duffy. Mr. Duffy votes aye. Ms. Wilson of Florida. Off aye, on no for Ms. Wilson of Florida. Mr. Murphy of Florida. Mr. Murphy of Florida votes no. Ms. McMorris Rogers. Ms. McMorris Rogers votes aye. Ms. Sewell. Ms. Sewell of Alabama votes no. Mr. Schock. Mr. Schock votes aye. Mr. Nadler. Mr. Nadler votes no. Mr. McHenry. Mr. McHenry votes aye.
On this vote, the yeas are 229, the nays are 191. The motion to table is adopted. Without objection, the motion to reconsider is laid upon the table. The gentleman from New Jersey seek recognition.
I have a motion to recommit at the desk.
The gentleman opposed to the bill?
I am opposed to the bill.
The gentleman qualifies. The clerk will report the motion.
Mr. Andrews of New Jersey moves to recommit the bill H.R. 3350 to the Committee on Energy and Commerce with instructions to report the same back to the House forthwith with the following amendment. Strike.
Reserve a point of order.
Point of order is reserved by the gentleman from Michigan. The clerk will continue.
Strike all after the enacting clause and insert the following. Section 1, short title. This act may be cited as the Consumer Health Plan Protection Act of 2013. Section 2, maintaining existing coverage. A, in general, notwithstanding any provision of the Patient Protection and Affordable Care Act, including any amendment made by such act or by the Health Care and Education Reconciliation Act of 2010, in the case of health insurance coverage offered by a health insurance issuer in the individual market that is in effect for an individual as of October 1, 2013, the issuer may continue such coverage for such individual for a plan year beginning in 2014 in such market outside of an exchange established under Section 1311 or 1321 of such Act, 42 U.S.C. 18031 and 18041. B, treatment as grandfathered health plan in satisfaction of minimum essential coverage. Health insurance coverage described in subsection A shall be treated as a grandfathered health plan for purposes of the amendments made by Section 1501B of the Patient Protection and Affordable Care Act, C, notice. As a condition for a health insurance issuer to continue health insurance coverage under subsection A, the issuer shall provide for notice to each individual to be offered such continued coverage and for other individuals covered under health insurance coverage offered by such issuer for whom such continued coverage is not offered. Prompt notice of the following. 1. The health insurance coverage options available to the individual through the marketplace under the Patient Protection and Affordable Care Act and how to exercise such options. 2. The premium and cost-sharing assistance available for coverage obtained through such marketplace.
Clerk will suspend. House will come to order. House will come to order. Clerk may continue.
2. The premium and cost-sharing assistance available for coverage obtained through such marketplace. 3. The consumer protections provided under such act that are not provided under the continuing health insurance coverage. D. Construction regarding notices of cancellation or conversion. 1. In general, nothing in this section shall be construed to prevent the Secretary of Health and Human Services from requiring state insurance commissioners, A, to investigate and take appropriate administrative or other actions, such as the imposition of a fine, on cases of inadequate notices of cancellations or conversions of health insurance coverage in the individual market that take effect on or after January 1, 2014, and B, to submit to the Secretary reports on the investigations and the actions so taken. 2. Inadequate notice. In this subsection, a notice of the cancellation or conversion of individual health insurance coverage shall be treated as inadequate if the notice, A, fails to contain information contained in subsection C, B, fails to be transparent by inappropriately steering individuals to more expensive plans provided by the canceling issuer, or C, fails to otherwise comply with requirements of law. E, construction regarding protection against discriminatory rates. Nothing in this section shall be construed as preventing the Secretary or the relevant state insurance commissioner or state regulator from taking corrective actions to ensure that any excessive, unjustified, or unfairly discriminatory rates for the continued coverage offered under subsection A are corrected prior to renewal. F. Construction regarding premium protection. Nothing in this section shall be construed as preventing the Secretary from using all available tools to ensure that marketplace premiums are not adversely affected by the operation of this section.
House will come to order. Members will please take their conversations off the House floor. Gentleman from New Jersey is recognized for 5 minutes in support of his motion.
I ask unanimous consent to revise and extend my motion.
Without objection.
Thank you, Mr. Speaker. Thank you, Mr. Speaker, and thank you, colleagues. We come here as stewards of a very sacred trust to look after the people that are the backbone of this country. And we are having this debate this afternoon because we've all heard from men and women across this country who are very upset that an insurance policy that they want to keep has been canceled. And Mr. Speaker, the House is not in order.
House will come to order. Gentleman from New Jersey.
Thank you. These constituents are very upset and very troubled, and we're brought here to work together to figure out a solution to that problem. What's the solution? Well, first of all, they ought to have the ability to have their insurance company offer them the policy for sale Frankly, the underlying bill does that, and so does the plan that I'm presenting. But second, there ought to be some way that the insurance companies are given some incentive, at the very least, direction to sell the policy. It doesn't do you a whole lot of good to have the right to buy a policy the insurance company's not selling. And this plan has some measures which make it more likely that insurance companies would do that. Thirdly, to solve that person's problem, we have to make sure that in solving their problem, we're not creating another one. That by permitting these policies to be sold for another year, which this does, that we're not spiking the premiums of people in the exchange marketplaces or people who get their insurance through work. Mr. Speaker, the House is not in order.
House will come to order. Gentleman from New Jersey may continue.
I've heard a number of members say that they want a chance for us to work together to solve this problem. Here is that chance, because this plan does the three things that I just talked about. But this plan, I think, is different than the underlying bill, because this is not a step to unravel the Affordable Care Act. It is a step to improve it. And that's the fundamental question. Because there's some other people whose stories ought to be told here this afternoon, too. There's a family this weekend that's having a social to raise money to pay the medical bills for their son or daughter who has cancer, because the insurance policy they thought they had stopped paying their son or daughter's bills. Their voice should be heard. If you repeal the Affordable Care Act, their voice is silenced. There are women in this country who go to try to start a business, and they try to buy an insurance policy, and they're told, we won't sell you one because you've had children, you're a female, you had breast cancer 10 years ago. If you repeal the Affordable Care Act, her voice is silenced.
House will come to order. Gentleman may continue.
Mr. Speaker, there are sons and daughters of Americans who are 22, 23 years old, who didn't have health insurance before because they couldn't get that first full-time job, who now have health insurance because of their mom's or dad's policies. If you repeal the Affordable Care Act, their voice will be silenced. There are senior citizens who used to run out of drug coverage, prescription coverage, around Labor Day because the Medicare donut hole popped up. And because of the Affordable Care Act, they are now able to buy their prescriptions at an affordable... Thank you, Mr. Shimkus.
House will come to order.
I'm obviously having an effect on Mr. Shimkus, and I appreciate that. They are now able to pay their prescription bill to the end of the year. If you repeal the Affordable Care Act, their voice is silenced. We come here this afternoon to solve the problem of Americans who want to keep their coverage but have had it canceled. We want to work together to solve that problem. That's what this plan does. But when we look at women being turned away because of pre-existing condition, we will not be silenced. When we look at 22-year-olds who will lose their coverage if you repeal the Affordable Care Act, we will not be silenced. When you look at seniors who will lose the ability to pay their prescription drugs, if you repeal the ACA, we will not be silenced. We are here to solve problems, not create them. If you want to work together in a way that improves this law, we are your able and willing partner. But if the intention is to unravel this protection for the American people, we will stand, we will speak, we will fight, and we will oppose every such effort. Vote yes for this motion and no on the underlying bill.
For what purpose does the gentleman from Michigan seek recognition?
Mr. Speaker, I would claim the time in opposition to the motion to recommit.
The gentleman from Michigan is recognized for 5 minutes.
And I withdraw our motion to, or the reserve.
Reservation is withdrawn.
Correct. Mr. Speaker, the debate today on whether to support this bill comes down to a very simple question. Why not? If millions of Americans want the choice of keeping the insurance that they have, why not? If you believe Congress acting together, not the President acting unilaterally, should try to help people who have lost their coverage, why not? And if you believe that ordinary Americans, not the federal government, should decide what their insurance plan looks like, why not? We have a chance today to provide hope to millions of Americans who got that cancellation notice. Hope that they can keep the insurance that they like, hope that they're going to have even more choices, and hope that they, not the federal government, can pick what their insurance plans actually looks like. So let me be clear. Our bill, H.R. 3350, does not fix Obamacare, the President's health care bill. It's only an attempt to help people harmed by this law. But if we can provide some relief to people from this disaster, why not? So let's defeat the motion to recommit and pass the underlying bill. I yield back the balance of my time.
Without objection, the previous question is ordered on the motion to recommit. The question is on the motion. All those in favor say aye. Aye. Those opposed, no. No. The noes have it. The motion is not agreed to.
Mr. Speaker.
Gentleman from New Jersey.
On that, I demand the yeas and nays.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, the yeas and nays are ordered. Members will record their votes by electronic device. This will be a 5-minute vote. Pursuant to Clause 9 of Rule 20, the chair will reduce to 5 minutes the minimum time for any electronic vote on the question of passage. This is a 5-minute vote. Are 187. The nays are 230. The motion is not adopted. The gentleman. The question is on passage. Those in favor say aye. Those opposed, no. The impeding chair, the ayes have it. The resolution is adopted. Gentleman from California.
I demand the record vote.
A recorded vote is requested. Those favoring a recorded vote will rise. A sufficient number having risen, a recorded vote is ordered. Members will record their votes by electronic device. This will be a 5-minute vote. On this vote, the yeas are 261, the nays are 157. The bill is passed. Without objection, the motion to reconsider is laid on the table.